Grab a seat. There's some seats up front if people need seats. So good evening, and I hereby call the Palm Springs City Council Special Council Meeting of January 29th, 2022 order, and welcome everyone. And for those who are able and would care to join me, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. City Clerk, will you please call the roll?
Councilmember Garner.
Present.
Councilmember Middleton.
Present.
Councilmember Woods.
Present.
Mayor Pro Tem Holstedge.
Here.
Mayor Kors.
Here.
All council members are present.
Great, thank you. So the first item on the agenda is the Affordable Housing and Homelessness Standing Committee comments, which is myself and Mayor Pro Tem Holstedge. And I first want to start by welcoming everyone here. I know a lot of folks here joined some of us at 5:30 this morning to do the homeless point in time count. So thank you. I hope you all got naps during the day. But I really just want to thank people who did that. And if you haven't done it, to please do it next year. We had over 100 volunteers today who helped us go out and speak with our homeless residents, to count them, which is critical in order to get funding, such as the funding we are going to be discussing tonight, but also to learn why people are homeless, what the issues are, how they became homeless, and the kind of data that we need so we could direct services to the right people. So really appreciate everyone who got up so early and joined us for that. It's such an important piece of this. So this is a study session, so it's a little different than a regular council meeting, and sort of want to explain that for folks. It will seem pretty much like a regular council meeting, although there's really only one item that we're discussing here tonight. And what we're going to do is, Mayor Pro Tem Holstedge is also the chair of the CVAG Homelessness Committee. So she's going to do a little update on some of the current programs that are happening in Palm Springs in particular, but also in partnership with CVAG. And then we're going to do our staff report, which is Barbara Poppy, who will be doing a presentation. And we brought her in. She's an expert on homelessness. She'll share her background. She's done work in the Valley before to really present different options for us to consider for the funding. And that's really important right now because by mid-February, we do have to fill out the application to the state, even though we've been allocated the funding, for the types of programs or projects we're going to do. This is one-time funding, so it's important to keep that in mind. It's not ongoing annual funding. So she's going to present that so we can get feedback, and we're going to start with some feedback from some of our partners who we contract with, a few elected officials, and get as much information out as we can, and then we're going to open up for public comment so we can hear any ideas or comments from what you've heard or other ideas you have. So that's sort of how this process is going to go. And with that in mind, I'll turn it over to Mayor Pro Tem Holstedge.
Thank you. Thank you all for being here. It's incredible to see how many people care about homelessness and housing in the Coachella Valley. So thank you for taking the time of your evening to be here with us today. I'll just briefly add to the procedure. So we're applying for this funding even though it's been allocated, and there are rules from the state about what we're allowed to apply for, and there'll be more information about that later. This is the one opportunity really to discuss the direction that we're going to take as a city for that funding, and then we'll make our application to the state, which is due February 15th. However, as we move forward, there will be a lot more public opportunities for input as we really develop a program and a plan for this funding. So really briefly, I think I just have a few minutes to give a few years of history here. But we'll remember that the city had Roy's Desert Resource Center. I see I think Councilmember Jenny Fote, who's retired, who just walked in, who really led the charge to have Roy's here in Palm Springs. It opened in 2009, and it was closed by the county in 2017 to operate as a mental health facility. Then we started doing, as a region, Desert Healthcare Foundation provided a matching grant to the city of Palm Springs to do behavioral health crisis specialists. So we have we have 2 teams in Palm Springs of behavioral health workers who go out and meet people and send them to services and provide referrals. We're also funding, with the help of Desert Healthcare District, I see the CEO is here, funding wraparound services with Martha's in Palm Springs, which is really important to get Martha's physically located in Palm Springs to provide such important services. That ongoing funding is really critical. The city also funds Well in the Desert Day services. So the city provided a grant of $75,000 to the Well in the Desert, generally annually. We've done in the last few years to provide a cooling center. The county provides cooling centers in Palm Springs at different locations, but we thought more was needed. And they provide counseling services, showers, food, water, things like that. For the Coachella Valley Association of Governments, as a valley, we came together and did CV housing first. And so though we no longer have a shelter in Palm Springs, we are funding, and now we have almost all of the cities in the Coachella Valley funding this program to provide people and put them in housing. And so in the last few years, we've housed close to 300 people. And the success rate of that is about 65% of those people go into permanent long-term housing and get off the streets. So the success is really apparent. And so we contract with Path of Life Ministries, CVAG does, to provide those services. And they have crisis stabilization housing to get people into housing. And then in the summer of 2019, the city opened the boxing club here in Palm Springs as a cooling center so that people would have a place to sleep overnight in the heat. And we've maintained that, and the city has funded that to go through now as a warming center as it's cold outside and people need space to get out of the elements. So those are sort of the services that the city and CVAG provide together. The county obviously does a lot more for housing. I see our Riverside County Supervisor, Manuel V. Perez, is here, so thank you for being here. But that's really what we've done as a city for the last few years. This is the first opportunity we've really had for a huge chunk of money like this, $10 million. We're the only small city in the state that got this funding. And we have been working as a council for that funding, and Assemblymember Chad Mays was instrumental in fighting for that money in Sacramento. So this is our opportunity to hear from our consultant and from the public. We've invited everyone to kind of give us your ideas about how we can direct this funding, what we should spend it on, the path that we should take going forward to really address homelessness. And I think this is a great opportunity to truly make an impact. And though we won't ever solve homelessness here, we can really make an impact for people who are living on the streets now and to get people into housing.
Great. Thank you very much. So we're going to move over to the staff report, and it's ideas regarding homelessness, program planning and strategies, and Barbara Poppy and Associates is doing the work, so I'd like to invite Ms. Poppy up, and welcome, and thank you for your work.
Thank you. It's really good to be here with you all. It is really good to be with all of you as well. It's encouraging to see so many people who have turned out. I am going to both manage the mic and the clicker and talk and walk, and we'll see how this all works out. But thank you for having me here. As it was said, I was hired as a consultant on this project. A little bit about myself is I've been doing national consulting since I left the Obama administration, where I headed the U.S. Interagency Council on Homelessness from 2009 to 2014. And during that period, I had the chance to work across 19 different agencies, as well as with communities and states and private sector, and it really expanded my horizons. Before that, I had worked in Columbus, Ohio, running a public-private partnership that was dedicated to addressing homelessness. Essentially, I have been trying to, in the ways that I can, to solve the housing crisis, the homeless crisis, since 1983. So it's really very much my life's passion. Unfortunately, we are still here talking about it today. One of the things that I did when I was with the administration is we launched the first ever comprehensive plan to address homelessness. And as a result of that plan, which was called Opening Doors, we've seen a 50% reduction in homelessness among veterans. So as we start this out, I just want to say we know we can make a difference when we have the right amount of resources dedicated and we use the best practices and we work collectively and collaboratively together. It really is about a partnership. So I start with that because it gives me hope and encouragement that in fact we can make your community better and we can make the lives of the people who experience homelessness better. And what isn't in my deck, but I'm going to add through this, is I had the opportunity today to spend some time at the Well in the Desert, and then I went to the boxing club, and I facilitated a focus group with people with lived experience of homelessness, both who formerly homeless and currently homeless, about a dozen individuals who had been served by some really strong organizations in your community, Coachella Valley Rescue Mission, Martha's, Well in the Desert, and Path of Life Ministry. And I just want you to know from their perspective, you've got a lot of strengths that you're going to be able to build from, but there's a lot of gaps. And I left that focus group both inspired, but also with a strong sense of urgency. And so as we go through the presentation, which was prepared before I had the chance to have the focus group, I'm going to try to remember to add some of the thoughts that they had as we go along here. So with that, the presentation is going to start out with just a little bit of grounding in best practices and definitions. I'm going to talk a little bit about the consultation process and give you some background on this very wonderful source of funding that you have available to yourself. And then I'm going to talk about the perspectives of key leaders in your community who I interviewed as part of the process, and then provide for you what I think are some options and opportunities for you to consider as you think through the investments that you're going to make. And then obviously we can take questions. Just as we start out and thinking about homelessness, I think it's really important that yes, homelessness is by definition, it's someone who does not have a place to live, so they're without housing. But, and that housing is out of reach both in terms of the supply as well as the affordability. The rents exceed their income. Related to that, though, is often people have inadequate income, and sometimes that inadequate income is a crisis causes it. They lose their job, and that causes them to lose housing. But some people have a chronic issue where their income is chronically below what the rent costs. They have a disability. But we also know that people who become homeless often lose their jobs. And so loss of housing can cause job loss. And we also know that it is related to health issues, both chronic as well as crisis issues. And in fact, what we know is that health issues are both a cause and a consequence of homelessness. The longer people are on the streets and without housing, the greater their health needs become. It increases the level of addiction. It increases their experience of trauma and violence. And domestic violence is very frequent on the streets. So I think it's very important to think about this as a multifaceted problem. The core of it is we've lost housing, but that loss of housing has a lot of other consequences as well. So just about a year ago, I was able to work with the Desert Healthcare District and a whole collaboration across the Coachella Valley, and I issued a report based on the facilitated process called the Path Forward, Recommendations to Advance an End to Homelessness in the Coachella Valley. And in that report, we recommended 3 types of responses. One is housing solutions. Housing solves homelessness. Also, an effective crisis response, and then really press for the importance of alignment. You can't have multiple programs going in all kinds of different directions and expect individuals to figure that out on their own. They really need an aligned and coordinated system. The Path Forward had a specific set of recommendations. Many of those recommendations, as I understand it from the interviews that I've done, are underway. But this is also an opportunity for Palm Springs to align your efforts with the Path Forward, which was a comprehensive approach to addressing homelessness in the Coachella Valley. There's a few definitions that I wanted to just kind of start out with. So one of the recommendations of the report was to expand the use of diversion or rapid resolution. And rapid resolution is a way to help households avoid homelessness through a crisis, through a problem-solving conversation that also sometimes has some resources attached to it. So rapid resolution, there's a very specific set of training. My understanding is that training has been offered in this community, and there have been some dedicated funds to it, and it's been very well received from the interviews that I did. A second type of response is one that helps people access the rental market, and it's called rapid rehousing. It includes helping people find an apartment, cover some of the move-in costs, and then provides a transitional rental assistance and home-based case management. Both rapid resolution and rapid rehousing are eligible for funding through the HHAPE. Bridge housing is a term that's used nationally, but locally you call it crisis stabilization. It's intended to be interim housing that when someone has a housing match but hasn't yet found the apartment, they can stay in this crisis stabilization or bridge housing. Permanent supportive housing is long-term affordable housing with community-based and on-site services that provide a long-term solution to people who are experiencing chronic homelessness, which is people with disabilities and repeated episodes of homelessness. In your community, as I said, you are doing bridge housing and permanent supportive housing successfully. Both of those are also allowed to be funded through this initiative. So as we think about this consultation, know that I was asked to build from the work that I did with the Desert Healthcare District in 2018. It's also to provide you with some of the best practices, and I can go fairly deep into those. It's a time to solicit input and ideas and then to share with you what my recommendations are. These are the steps of the consultation process. You can see I've talked about the interviews, I've reviewed documents, I conducted the focus group today, making site visits to projects that I haven't. I will say the last time when I was with the district, I got to go out with Path of Life out onto the desert doing outreach, so I feel that I've gotten a pretty robust sense of kind of what you are seeing and then ultimately come up with some recommendations. So as we set forth on what your application should do, it's $10 million, and you want to be sure of course, it conforms to the requirements. That's a fairly obvious one. But you also, this is a one-time opportunity to contribute to a truly meaningful and measurable reduction in homelessness in your community. I understand you want to be aligned and support the regional approach, and you want to find cost-efficient, rapidly deployable building technologies, practices, financing strategies, and policies that can be implemented in Palm Springs, and then the hope is this can be replicated in other communities. And I just want to underscore this importance of rapidly deployable, given the urgency that I heard from the people in the room today with the focus group. There, I'm going to be able to present to you many ideas about how you can leverage other funding sources and partnerships. You really want to see that these dollars bring together other dollars and you get a tremendous bang for the buck. And then finally, you're going to have to be very thoughtful about investing in projects that can be sustained in the long term, not just a one-off project. Okay. So, the program. The Homeless Housing Assistance and Prevention Program is intended to support regional coordination or expand or develop local capacity to address immediate homelessness. The state requirements are that it must be informed by a best practices framework focused on moving homeless individuals and families into permanent housing and ensuring those individuals can maintain their permanent housing. So you want to think about the purpose of the funds and what you can use them for and make sure you're making those particular linkage. As we've noted, there's $10 million dedicated to Palm Springs. Some of the things that are prohibited is you cannot use this dollar to supplant existing local funds for homeless housing assistance or prevention. So effectively, all of the things that were just discussed that you're doing in this community right now, you cannot use these dollars to do that because that would be supplanting those funds. So it's really important to make sure and to know that you need all of the existing sources of funding to continue. There's a mandate that 8% of the funds has to be specific to the needs of homeless youth. So there has to be a homeless youth identified project that gets at least 8% of the funding. And on a permissive basis, you can use up to 5% for planning, infrastructure development, coordinated entry, or homeless management information system, otherwise known as HMIS. And you can use up to 7% for your administrative costs incurred to administer the funds. So those are the mandates around this. There is a pretty strong list of eligible uses: rental assistance and rapid rehousing, operating subsidy in existing or new affordable or supportive housing, emergency shelters, navigation centers, landlord incentives, outreach and coordination to assist vulnerable populations, system support for activities to create regional partnerships, delivery of permanent housing and innovative housing solutions such as hotel and motel conversion, prevention and shelter diversion, and here locally we call that rapid resolution, to permanent housing, and new navigation centers and emergency shelters based on demonstrated needs. So those are the different ways that the $10 million can be used for. So what I did is I worked with your great team of city staff and members of council and helped to identify who were the key leaders in this community who were working to address homelessness and would have firsthand information. You can see I interviewed, I think, 11 different organizations. Here's what I learned from those organizations is I learned that those who experience homelessness are predominantly single adults and couples without children in Palm Springs. Very few children or youth. There is a growing number of seniors that people are very concerned about. And the most challenging to serve are people with severe, persistent mental illness and addiction. And I looked at two different data sources, and it looked to be about 10 to 12% were families with children, whereas almost 90% were single adults and couples that fell into that category. When we looked at, why did people believe that homelessness was a challenge, what I was told was rents are increasing, and the city of Palm Springs has not been building or replacing rental housing for the lower income households, including seniors. So there's a growing gap in the resources that are available, and that people fall out when the rents are up. A number of people also talked about the fact you have a good seasonal workforce, and that there are few jobs available during the summer, and so you'll see homelessness up in the summer when people are unable to pay rent. And related to that, it often is a downward spiral from once you become homeless, and so people are falling into that. I want to say that City of Palm Springs was viewed very positively as a good collaborator on service delivery, and particularly calling out that you've had much more active engagement on this topic recently, and that's appreciated. Collaboration is improving among the nonprofit organizations, but there still is some level of mistrust and miscommunication remaining. But the work under CBAG and the Path Forward report to create a Coachella Valley Heart has been gearing up publicly recently, but that's also been helping bring providers together. So I think good news on collaboration is it's continuing to improve with more opportunities out there. I asked the question, so how do people fall into homelessness, and what could we do to reduce that inflow? Because when I look on the West Coast, the cities that I've worked in, that they describe the problem of homelessness as growing, what they've been able to track to is the problem is that there's more people falling into homelessness than are able to be exited. So you really need to pay attention to that inflow and the importance of preventing homelessness. So what I was told is this recent work on rapid resolution is a great resource, and that has been very helpful. There's transportation assistance that's provided to help people get back to their home communities. That was viewed as very positive. Martha's is opening a medical respite program. It's open. It's open. and that's viewed as a positive way to help people avoid homelessness exiting from the hospitals. And then the other point that was made is, feeding programs are a great way to keep people's expenses down because they can go for assistance, and that those are really important in the prevention. But what isn't working is they're seeing more evictions due to rising rents, and this is particularly a problem for seniors because they are on fixed incomes and they get priced out with really relatively small amounts of changes in rent. There are also households who have a financial crisis, and maybe a one-time financial crisis, but they face eviction. And then the other was, and this came up across several interviews, is that you apparently have a lot of recovery or sober living centers. Very often they are contributing to homelessness because people are being discharged without a housing plan. This came up sufficient enough that I think it must be a real issue. I don't have data to show it, but it was consistent across many of the interviews. So what's happening to address homelessness? Well, the good thing is your community is using shared housing and permanent supportive housing very successfully. Rapid housing was also mentioned today. You've been able to engage landlords. The Well in the Desert provides really important day services and a place for people to be in, but also to be networked with. You've been able to move to more of a year-round overnight shelter cooling center at the boxing club. And CVAG is working to establish a multi-service center at the boxing club. I put this quote up here, which was, "The boxing club helps a bit. It does decrease immediate needs. It's slightly more organized, but it's not really set up to help people self-resolve, and it's unlikely to create ways for more people to get off the street." So it's not, the boxing club on its own is not sufficient, is the takeaway here. It is positive, but not sufficient. When we look at housing challenges, the issue that rises quite to the top is that the shortage of affordable apartments, the shortage of permanent supportive housing, both slots and units. There's a need for both full subsidies, but also shallow subsidies. And what a shallow subsidy is, like if you think about a disabled or an elderly person and they have a rent increase, and maybe the rent increase is only $100, if they could get that $100 a month as a shallow subsidy, that will be all the difference they need in order to sustain that housing. And so that's not a full-on subsidy, but a shallow subsidy. Also, increasingly landlords are unwilling to take people with poor credit, prior eviction, and or criminal histories. Today at the focus group, a number of people talked about the immense cost of moving into an apartment and their expectations. 6 months track record of solid income, multiple deposits, and double deposits, as well as first and last month. So the cost to get into an apartment is getting higher and higher. I think this was an outreach worker made this comment to me, which was that it really isn't hard to find people on the streets who want to leave the streets. It's really just hard to put them in housing. And so there's a tremendous need and desire for people who are outside to come inside. And I can say from the focus group, that was definitely a clear message. On the crisis side of things, your challenges, there's an insufficiency of 24/7 shelter beds. You do have people who aren't going to access congregate shelter because of their disabilities, because of their prior histories of trauma. It also is, I heard multiple stories today through the focus group, but also this came through the leader interviews, is people are not getting connected to benefits in an expeditious way. Lots of criticism of the county processes to not provide easy access and same-day access the way some other California counties have done that. It was noted there's not a timely access to medical detox and services for people with mental illness. And finally, there are physical health issues that go unaddressed and are not there. Comment I just want to share is that people who are unsheltered are mobile, so it's hard to consistently connect them back to services, and when a housing match does occur, it's difficult to find them. So with folks having to be mobile, it's hard to address their needs. So what are the better ways to address homelessness? Well, universally, this idea of more permanent supportive housing, because there are a lot of the people who are experiencing homelessness in this community have been homeless for a very long time. have a high level of disabilities, and they both need long-term housing and the supports to make that housing work for them. There were recommendations around expanding crisis stabilization units. The bridge housing has been working. There's an opportunity to expand that, and we get more people inside into non-congregate housing. There's the opportunity to build out a full-on navigation center on the city-owned property at the boxing center. Another idea was to think about how you can figure out the cheapest ways to serve the easiest to rehouse people, and being very creative about finding a solution for everyone. And I definitely heard that today at the focus group, is that we need a range of solutions and be solving for everyone, not just folks with high vulnerabilities, but the whole range of people who experience homelessness. And I think that this idea of finding some inexpensive ways to help the easiest to serve would be a great thing to do. And then certainly the key leader interview said there needs to be more access to showers, to laundry, to restrooms, and to safe storage. That was definitely underscored today. The reason people resort to shopping carts is because they have to have some way to carry their stuff with them all day. From the outreach perspective, from the police perspective, shopping carts become the things that are considered problematic for many of the neighbors and result in more complaints. So I think those are ways that could be used. So, as you approach your funding, what I would suggest to you, you could think about is that, first of all, if it's at all feasible, try not to spend any of the dollars on planning, coordinated entry system, or HMIS. Work that out to see if you don't need to invest new in that area. For the focus group today, they would say they don't want a bunch of new bureaucrats being hired, because the relief ought to go directly to them. So I think I represented that one. Okay, good. Applause line, like it. All right. You can spend up to 7% on admin. I would suggest you include in that your leadership and accountability, and I want to talk about that because there's a tremendous, I heard a lot from I think every interview as well as the focus group. It's about the importance of transparency and accountability in that, so you want to be really careful in that. The state does require a mandatory use set-aside, so 8% gets set aside. What that leaves you then is 85% could be dedicated to new housing and services. So if you did that, what it would look like is you'd have $8.5 million available to invest in new program purposes. And again, we want to think about those as those one-time dollars, right? Not services out the door, but for the purpose of benefiting people. So in the leadership and accountability, there's 3 recommendations that I would encourage you to think about. The first is to develop and implement contract and grant standards that include performance and outcomes. The state does require that HMIS participation is necessary, also require collaboration with other providers, require that all of the practices are aligned with best practices, and require this type of compliance on all city grants so that you have a unified and accountable approach to this. There's an important feature you want to build into this, and that is this level of transparency. A way you can get to a high transparency is for you to require updates back to you. I'm starting some work in the city of Austin, and they have a council briefing every other week because that's the accountability they're holding their administration to. I'm not saying these are unaccountable people, but just that practice and urgency comes by that regular reporting. The second piece is, this came up in multiple ways, is the importance of having a civic engagement campaign, both to raise the private funding and some additional capital dollars. There's a great opportunity for pro bono services, architectural services, engineering services, other types of design services, because you really want to build your cohesive community response to address homelessness, the sense that you're all in this together. And so you want to think through how these dollars can help you really build momentum across the sectors. I would suggest that you are going to need to dedicate one position to really serve as the director to make the collaborations happen, to provide those regular reports, to be the expert on it, and to really drive the change. If the work is all delegated across staff positions, they don't have that urgency of focus that you have. I would not build a whole big staff of as we had said earlier, bureaucrats, but I think you would benefit by having a strong point person who could really ensure you're getting the best bang for your buck. On the housing options, I think there are three that really rise to the top. So the first is creating new permanent supportive housing and new bridge housing units. And by that I mean those are slots that don't exist today and having those be available. Because your market is so tight, if you don't use some of these funds to create some new units either through rehab or new build, you continue to kind of lose it. The second, though, is that there is tremendous need for one-shot assistance and rapid rehousing financial assistance to exit homelessness. And I definitely got that as well from the focus group today, is that some folks are having to wait in the shelter till they save up enough money, which means they're taking up space as well as not moving on in their life. So this idea of expanding that one-shot rapid rehousing assistance would be great. And then thirdly, you probably will continue to need to offer landlord engagement incentives to get the rest of your market engaged in it. So I'm going to talk a little bit about, in particular, bridge housing and permanent supportive housing. I've defined those before. I'm showing that just real quickly again, so we remind that. So when you think about permanent supportive housing, it takes four things, basically. One is you need the land. Second is you need dollars for the capital development. You need some form of a rental assistance or operating so that it is affordable to people who are going to be on fixed incomes. And you need to be able to provide some services. And in most communities that I work in, it's really hard to figure out how you pull that together. But in your community, I think you actually could in short order, and because you've got some great possibilities out there. So first of all, to create these new units, your potential partners are, first of all, the state of California. Beyond their funding of this, they have other funding streams that could be leveraged. And so you want to think about them as a funding partner and leverage all the dollars that they have. Locally, you have Lift to Rise, you have LISC and National Equity Fund, and or Enterprise, or get them all going on it. But you can raise some private capital. You are a community that you should be able to raise local capital, both through financial institutions as well as individuals who might be willing to put some money, invest in housing. Your Riverside County has home funds. It has other resources, and you have the opportunity to pull SB2 funds. Your housing authority is a willing partner to bring project-based vouchers to the new slots that you create, the new permanent units that you create. You have a willing partner at the county and the Department of Behavioral Health for No Place Like Home investment, ongoing intensive case management and other services, and also the potential of funding some bridge housing subsidies on an on-demand basis. Because right now, they're purchasing motel rooms on an on-demand basis. If you did some motel conversions, they could also use those funds. You have DPSS is also doing that. They could be a source of funding. You have tremendous health centers and health systems, IHP, who also are capable of investing and being your co-partners in services, capital investment, and our understanding is some of them are even providing bridge housing subsidies right now. Finally, on land, could you go to the Agua Caliente tribe, your school system, churches, others who can provide free or low-cost land and bring that to the table? Leave no stone unturned. So I just want to say, when I look at this list of potential partners, this is just amazing. This is just amazing, because I hardly ever, I have to say to them, you've got to find how to fill this one hole. What I'm saying to you is I think you can do it by just leveraging all these different partners who are more than willing to work with you. So the models that you can do, you also have a range of ways you could create this, both bridge housing and permanent supportive housing. One is you could dedicate units within new affordable rental housing, so look in your pipeline and ask that there's a set aside. You contribute a little bit of funds and you get 5 to 10 units. You could rehab existing apartments and dedicate some or all units. Motel conversion came up time and time again as a way to quickly bring folks on. You could also, and I've seen some communities do this, where you purchase scattered site condos, particularly ones that are less desirable, more affordable, may be a quick way to get some units on it. You also have the opportunity to build on your city-owned land or other free land. So, lots of development models. Your role could be, and should be, I would say, you should be identifying potential sites. You should provide land whenever possible. You really, really, really need to use the state streamlining tools to expedite development. That has to be a very high priority. You have new tools available to you. You need to plow through. You also could offer other incentives for projects for participating and move them to the head of the line because they're going to do things. So think creatively about it. All right, so now I'm going to shift to prevention. And I picked out 3 things that I think in particular I would suggest you focus on. So the first is I would really focus on preventing homelessness for seniors who are at risk. And that the need is really for emergency and shallow rent assistance, which again is just a really efficient way to help people. And you can partner with Riverside County. Their Adult Protective Services has some very specialized programs. I understand Riverside County is also thinking about using some of its HHAP money for this purpose, and they've got the professional bandwidth to kind of help you on this, or you could do it on your own. You should expand rapid resolution. What providers have told me is they run out of the flexible financial assistance. A little bit of money in this area goes a long way. CVAG is the one who had organized the training. I think they could be your willing partners on it. And then I think it's worth really digging into this issue that came up is how do you reduce discharges from treatment and other institutions into homelessness? My guess is it's more than a Palm Springs problem, so you might want to look across the valley. You could spread this to also looking at other institutions that might be discharging into homelessness. So those are the 3 ideas I have on reducing inflow and prevention. On crisis response, first is creating a true navigation center with 50 low-barrier crisis beds for individuals. Focus on particularly on those who are chronically homeless and highly vulnerable, because it's a highly specialized program. I'm going to share with you the definition in just a second. But I also think you need to find other ways to get other people inside that may not need all of the services of a navigation center. And the way to do that could be to engage faith-based or other civic organizations to establish safe shelter options across all of the West Valley for families with children, for adults and couples who can resolve homelessness with light touch services, who don't struggle with addiction or other kind of challenging issues. And then thirdly, be sure that you're improving your day services to create safe, accessible storage options. Storage is really important, as well as access to shower, restroom, and laundry facilities is important, because you still need a respite place to go to meet your basic needs. What? Oh, it's me. Thank you. Okay. The navigation center, I'll just say, navigation center is a word that gets widely defined kind of across the U.S., but in particular in California. There's multiple definitions of navigation center. So for purposes of this grant, what navigation center is defined as is it has to be housing first, it has to be a low barrier service-enriched shelter, and be focused on moving homeless families and individuals and families into permanent housing. And its intent is to provide temporary living facilities while case managers connect with individuals to income, public benefits, health services, shelter, and housing. It is not intended to be an access center for the entire community. It's intended to be a very specialized shelter. So it's in their definition, that's how they've defined navigation center. So a few things to kind of think about what I don't think you have to invest in. So first of all, you can't, I'm coming back to this, supplant your grant program funding for existing programs. So you have to maintain your current level of effort. You cannot use these funds to it. You have some really strong outreach that's done between the police, DBH, Path of Life. DBH, I think it's called the Hope Team. I got the right word there? But there's really good, strong outreach going on. I don't think you're a community that needs to invest in new outreach services. I would not want to see you do crisis response investment only, because that's not going to reduce homelessness. So be very careful to not spend it all on a crisis response, because that alone does not solve homelessness. I would also be careful to not just co-locate services only. You have to be sure that if you do a co-located services model, you include housing as part of that, because that's what's going to get people out of homelessness. And then finally, I would be very careful about how much you invest in ongoing operating costs, simply because it's one-time funding. So back to the big graphic here, 85% should be dedicated to new services. The mandatory use set aside, my recommendation there would be to explore with the others that are getting the HAP funds how you might partner with them. I think the COC and the county both have to solve this as well. Since you don't have a significant youth population here, it probably is a better use of resources to partner with other entities to do that. So when I think about how I would spend the money, is that I would focus on housing and more housing, because housing and more housing reduces the demand for prevention services. It will make your crisis response work more effectively. And then you just need a little bit of additional support down there to kind of hold it all together. And so you get to make those decisions about what those approaches are, but I think you've got this really once-in-a-lifetime opportunity to really change the dynamic and help people get access to housing, whether through rental assistance or new units, and all of those other resources. So it's pretty exciting. There we go.
Great, thank you. And chime in, everyone on council, if you have a different thought. But I thought before we ask any questions, we should have some of the key partners sort of do short presentations so people have that full information, especially with two council members who haven't heard some of this for the first time. So we're going to have just some of the existing partners speak, then we'll open it up to some questions, and then we'll have public comment. So our supervisor, Manuel Perez, is here. We're really thrilled he's here. For folks who don't know, the county is the social service agency. The cities in the valley don't have social service departments. And so the partnership with the county is, of course, critical in all of this, as it is with CVAG, that we're working on this as a regional approach. So we're really thrilled that our supervisor's here, and his passion and commitment on this issue has always been clear. So welcome.
Thank you. Thank you, Ms. Chair. And I also brought one of my favorite caps that I'll place on my head for you here, the Palm Springs Fire, for our first responders. Those of you that are first responders, I appreciate your work. So thank you, Mr. Mayor and council members, as well as congratulations, Council Member Woods, Councilwoman Garner, for your elections and being now a policymaker for the city of Palm Springs, and quite frankly, helping us work efforts at a regional level, which is very, very important as well. And Barbara, thank you for the presentation. I don't know where you went, but there you are. Great presentation, and it all makes sense knowing that there's a strong connection, quite frankly, from what you're saying and what our governor has been saying now for quite some time. And know that the County of Riverside is very much ready and supportive of all the efforts that are taking place currently, as well as knowing that we have still quite a bit of work to do. Not too long ago, I was asked to become part of the governor's task force on homelessness. There's 13 individuals that were selected throughout or appointed throughout the state of California. 3 of us were supervisors, Mark Ridley Thomas, for example, from LA, Nathan Fletcher from San Diego, myself representing Riverside County, a few council members as well, Mayor Libby Schaff out of Oakland, Mayor Steinberg out of Sacramento, Esmeralda Soraya out of Fresno, as well as Sofia Pereira out of Arcata. The goal there was to have policymakers from throughout the state of California, both at a regional, both at a urban as well as a rural and suburban level. We needed to make sure we had all these individuals. And quite frankly, the experts that were appointed included individuals that fight poverty, directors of social services, director of homelessness, a director from welfare services, as well as director from supportive housing. And so we've had a series of conversations already throughout the state of California, I think a total of 6, and we're going to continue to have more. And in our most recent conversation that we had with the governor as well as his staff was one in which we had a press conference, and we also went ahead and provided the governor an interim report that gave 40 recommendations. And still many more, I'm sure, that we can give. But to start us off and to get us going, 40 recommendations that also linked, if you will, to the $1.4 billion that are available to fight the issue of homelessness, and quite frankly, still needing more resources, we will continue to advocate. And what the governor tasked us to do was to work on 3 different goals. One was to reduce street homelessness. The second was to remove barriers in accessing care, specifically when we're talking about behavioral health care as well as services around substance abuse. And finally, as well, to ensure that we're able to reduce the cost or boost the supply of housing. But with that being said, we also felt, as Barbara Poppy mentioned, that there needs to be a strong emphasis in prevention. And so we also felt that it was important that we recommended or provided recommendations to the governor around areas specific to prevention. And quite frankly, we need to see this as having a sense of urgency. The governor has stated this, but we ourselves need to also be accountable. And we ourselves need to have that moral obligation, if you will, to have that sense of urgency within our soul of souls so that we can fight this and combat the issue of homelessness. It needs to come from within. It needs to come from with us. Now, I understand that we need to also work at the federal level and make sure that we advocate there. I understand that we should also work with our state partners, but ultimately here at a regional level, we also need to fight the fight and also localize it within our cities, within our special districts, within our school districts. It's really going to entail all of us to ensure that we finally end homelessness and make sure that it is obligatory, make sure that it is an understanding of a moral obligation that we have in order for us to tackle this issue. This is a social and economic crisis. This is a social and economic justice issue of our time, And so what we're saying here through the governor's task force and through our efforts here is it is our turn, it is our time for us to step up and make sure that we fight the good fight in a collaborative way and as well with regionalism. And so there are many recommendations that we provided, as I mentioned, and we have copies of these here. And as well, you can find them on the website. Some of them included, for example, comprehensive strategies when it comes to the Housing First model, rental assistance, a single point of authority for homelessness at the state level, perhaps even at a county level, supporting reforms to Medi-Cal for homeless service provisions, allowing flexibility in funding streams when it comes to the Mental Health Services Act funding, obviously increasing the production of affordable housing, but emphasizing the issue of fast-tracking permitting and looking at our fee structures as well. And what also came up, which is very controversial, but one thing that we need to continuously talk about is the issue of CEQA and reforming CEQA when it comes to the permitting process. Now, it was mentioned earlier about the successes that we have at the local level. One thing I like to say is that having the opportunity to see all the different strategies that are taking place throughout the state of California, I'll tell you, in Riverside County, I'm proud to say that in the Coachella Valley, in the Coachella Valley, with all the partners that we have, if you've seen that already as well through the slides, we are up front and center when it comes to having models and ensuring that we are doing everything we can to fight homelessness. And that should be attributed to not only our policymakers, but the community as a whole as well, because it's the community that's really moving our policymakers, including myself, to fight this issue. The one thing I want to end with, ladies and gentlemen, because there's a lot to be said, and I was giving 5 minutes, is that we need to continue with the collaborative approach. Greg Rodriguez, who also works on my staff and is working on the issue of homelessness through CVAG and through our cities, has also written a report known as CV Heart, and we need to take a look at that report to identify those gaps and to identify those challenges, to figure out how we can leverage the funding streams that exist at the state level, as well as leverage funding that exists here locally, as was said by Barbara, but as well private investment. We have to go out after, we should go after those dollars that exist that are out there. And there's many other recommendations that he provided as well, like staffing and structure and budget for a collaborative, as well as making sure that we elevate our work to the next level. And what that means is ensuring that we still continue to advocate at a federal level and at a state level so we can ensure the policies and the resources meet our needs here locally. And so with that, Mr. Mayor, I know I took a little bit more than 5 minutes, but this is such a major issue for all of us that I took a little bit more of your time. But thank you so much.
Thank you, Supervisor. You know, there are several reasons we're starting to see funding coming here. For way too long, we weren't on Sacramento's radar. And so having the supervisor on that council to be an advocate for us who cares so much about this issue is really a game changer for our region. And we so appreciate the amount of work you and your staff have done and will continue to do to help us on this. The money we're talking about today came from the state. That's where most of the funding will come from. And having a governor who's truly prioritizing this issue is making a difference. And we were also so fortunate to have our Assembly member, Chad Mays, who really took the lead when he reached out to members of our council on what our top priority was. And we said, homelessness funding. He really took that to heart, and once he started, he didn't let go. He is in Sacramento, so he's unable to be with us, but I know he has a representative here who just wanted to make some brief comments on his behalf, and we just are so thankful for Assemblymember May's leadership on this issue.
Mr. Mayor, you guys got me? Mr. Mayor, members of the council, appreciate being here with you this evening. When Assemblyman Mays asked me to make a few comments on his behalf tonight, I asked him what he'd like me to say, and he said, simply say thank you. I said, okay, Chad, what else you got? He said, that's it, say thank you. Being a local elected official is a lot more challenging than being a state official. You guys are here day in, day out on the ground doing the work that directly impacts people's lives, and this opportunity wouldn't have been possible without that hard work. So our office is really looking forward to seeing the positive change you guys are going to be able to bring to Palm Springs with these additional resources. We're looking forward to partnering with you in the future. And with that, just on behalf of Assemblyman Mays, thank you so much for your leadership on this issue and for everything you're doing for the Valley.
Great. Thank you so much. And I want to ask the CEO of the Desert Healthcare District if you'll come up for a couple of minutes. A few years ago, the Desert Healthcare District was looking at what their priorities were, and they made homelessness one of their top priorities. And it's through the matching grants that actually finally got all the cities in the Valley to come together and work together on a much more collaborative approach. But the district also has matched Palm Springs funding so we can have a second crisis team on the ground, so we can have the wraparound services that Martha's provides it well in the desert, and has also enabled us to keep the boxing club open. So thank you for that and your leadership and the whole district for all their work on this.
Thank you. And thank you, Mayor Kors, for your leadership. Thank you, City Council members, for your leadership on addressing the homelessness crisis that we have in our region. This is not happening in isolation. There are many partners that have been able to come together. I also want to acknowledge and thank the leadership in our board of directors at the Desert Healthcare District and Foundation. We have allocated nearly $4 million to help address this crisis of homelessness through different initiatives. Most important and the latest one has been the creation of the CV Heart. We continue to work toward identifying how best we can support the collective effort in our region. But in addition to that, we understand that behavioral health is an important component of addressing homelessness. And the district has allocated $2 million that we will be investing over the next few years to address behavioral health challenges that the homelessness community is facing, and providing a coordinated, collective impact approach to solving that issue. And in addition to that, I want to say that we also have invested in creating what is known as the Coachella Valley Health Information Place, or CBHIP, which is utilized by first responders and many of our partner agencies to help homeless people identify or find food, shelter, and other services that they may need. So this doesn't happen, again, in isolation. It happens through the work of all the collaborative organizations and government agencies in our region and in our district. Thank you.
Thank you very much. Mayor Linda Evans of La Quinta, who's here also for the Desert Care Network, thank you for joining us. Yeah.
Just kidding. Thank you so much, Mayor and council members, for allowing me to speak. Yes, I serve as both the mayor of the city of La Quinta as well as the chief strategy officer for Desert Care Network, which is representative of Palm Springs, Desert Regional Medical Center, JFK Memorial Hospital, and High Desert Medical Center in Joshua Tree. I, like you, have taken a regional approach in terms of homelessness and housing needs, as well as the network's approach for overall healthcare needs for the greater Coachella Valley as well as the Morongo Basin. And I had the pleasure of working with Barbara Poppy on her first run through the district in developing the path forward. And we found there, not only through that session, that study, but also through our CVAG efforts with Path of Life Ministries, that clearly the number of units is what our deficiency is. And so housing units is the critical component. But more importantly, from the healthcare standpoint, we need more of what Martha's has been able to do with respite and recuperative care beds. They've partnered with IEHP on a small scale. That can be replicated on a larger scale on the west side, because we see a number of homeless patients in all of our hospitals, especially here at Desert Regional Medical Center. And the challenge is some of them want to be on the street, some of them want to get better, but they need a little bit of a landing spot before they get back into their element or into a process for permanent housing. And to have that medical connection and that collaboration beyond the discharge from the hospital and or the emergency room will allow us to coordinate effectively with an FQHC model, with a housing model that then can be placed in permanent housing. So we have found that those patients, sometimes we have placed them in hotels, and we've had a nurse that's had to stay with them or visit them to ensure over the course of 3, 4, 5, 7, 10 days that they need to continue to have their medications, their dressings changed, things like that that have resulted in whatever their situation was. But if they're isolated and exposed on the streets, they're bound to bounce back into the ER. So our goal is to reduce the number of those visits, keep a healthy community. I've always said as mayor, a healthy community is a prosperous community, and we can do that because it's one of the fundamentals. Good health, good nutrition, those are foundations, as well as housing. So we definitely would support the continued collaborative approach on that, and know that the public-private partnerships have worked very well, and proud to continue to be part of this on a go-forward basis from the medical side, and how we can coordinate with our existing agencies. But units is really where I think the investment should land. So thank you very much for the opportunity to share our thoughts.
Great. Thank you so much for coming and joining us. The last sort of government piece of this is CVAG, which is the California Association of the Coachella Valley Association of Governments, which has a homelessness committee and has helped apply for and get funds, that some of which we're using in Palm Springs, and we're about to use some more. So Greg Rodriguez sort of is leading that on the staff level. So Greg, thanks for joining us.
Thank you, Mayor and Council and staff. And I apologize, usually I show up in a tie and suit, but I'm still in my pit count clothing for the day. So I'm Greg Rodriguez. I actually work for Supervisor Perez. I do all this homelessness, housing, and healthcare policy. Additionally, as a result of Barbara's report to the healthcare district that recommended the formation of a collaborative, CVAG basically charged me with the task over the last year to do a deeper dive into the great work that Barbara did and really find out what the true gaps are, but more importantly, what our best practices are, and even more importantly, about how we move forward together, collaboratively, in a regional approach to address homelessness. And so I've been tasked with that over the last year. Through that, it's been, as Barbara showed on her methodology, hundreds and hundreds of interviews, on the ground actually work, countless committee meetings, way too many committee meetings, but really have gotten a really good grasp. And as the supervisor said, just recently released a report on really what we're doing well here, how we're already working together, but more importantly, how we move forward and adopt, especially a lot of the recommendations that were not only in Barbara's original report to the healthcare district, but more importantly, what she's presented tonight. With that, we are establishing a collaborative here known as CV HEART, that stands for the Coachella Valley Homelessness Engagement and Action Response Team. I really want to emphasize the word action in that because, again, we're too many studies, too many committee meetings. It's actually time we start getting to work and getting things done. And I think Barbara's provided a great path for doing that. I will also emphasize, too, is it's not an establishment of a new bureaucracy. At least I'm trying to make it that way. I would really emphasize going forward as the Palm Springs City Council and staff looks at the recommendations for funding that we truly align with the work that's already being done on a regional approach, whether that's through CVAG, whether that's through the work of the Desert Healthcare District, through the work of the county, the continuum of care, and the efforts that the state are doing. The governor, as the supervisor said, is really looking for opportunities to fund and invest in and support regional collaborative approaches. The supervisor didn't mention this, but in our travels across the state, we really are leading the way in this state on that regional and collaborative approach. We've heard that from other portions of the state, but really on the ground, if you're seeing what's happening in other areas, we really have a great potential. Barbara emphasized that too in her report as you saw the number of partners and the potential partnerships that we already have established and how we elevate those to the next level. I'll end with the just kind of recommending, it's going to really echo a lot of what Barbara said. I feel like I could have written that report too standing here, but we really do need some type of navigation center in the West Valley. To Barbara's point, too, a true definition of an effective navigation center. I would highly emphasize, though, the need for housing, and you've heard that throughout the presentations. That's not just affordable housing, but it's permanent supportive housing, it's crisis stabilization housing or transitional units, it's respite care housing, as Linda Evans mentioned. It's just the whole host. We have people right now we can literally place into transitional housing, permanent supportive housing, affordable housing. We just do not have the doors, and so that really needs to be a key component of this. I would also emphasize, to Barbara's point, the expansion of diversion, rapid resolution. It is highly effective. It is highly cost effective. Our organizations are already doing a great job. We need to expand the training opportunities and funding opportunities to make that much better. And then prevention. A lot of prevention funding has been lost. We really need to ramp up the efforts on prevention, even more cost-effective than rapid resolution. I literally answer 4 to 5 calls from people who are on the verge of homelessness weekly. And really, it's just simply a car repair. It's a deposit when they're moving into a new place. It's a broken down refrigerator. That's really how simple this can be from preventing people from falling in. I'll end again that we really are a model here. I think this is a very unique opportunity. Obviously, Assemblymember Mays, I give huge praise to, especially as one who ran against him. I really take what he's done here. It's so good. But it shows that we really are a place that people feel they can invest in. We are on the right path. And I think with Barbara's recommendations and going forward and with the great leadership that the Palm Springs City Council has already showed, people don't really give credit to the work that's being done here already. The way the city has stepped up, the way the county has stepped up, the way that CVAG and the other 8 cities that are funding this really should be commended here. So I appreciate the time and thanks for your time. So.
Thank you. So as we want to get to public comment, if there are very specific questions that people feel they need to ask now or that they think would be really helpful for the public to hear the responses to before we do that, because after public comment, we'll have the chance to deliberate and ask our own follow-up questions as well. But if anyone has something specific they want to ask. Councilmember Middleton.
Barbara? Yeah. Could you talk about what you think some of the best practices would be for staffing and management of a navigation center?
That's a great question. Button down. Okay. The navigation centers that I have visited that follow that particular model, they have a very caring staff who creates a very receptive and warm environment that, and the facility is set up in a way that allows pets and possessions and is very person-centered, and provides access to be outdoor, some respite feeling. It's a very soothing kind of environment usually. And the staff are just highly skilled at supporting individuals, using harm reduction, using motivational interviewing, and working with people. Oftentimes, they also have a couple specialist positions, like they might have an addiction specialist or a mental health specialist, and then a housing specialist, so connecting them to housing. Because the ones that have been most effective have a connection to housing so that as a person is it's kind of the process of when people come in, they've had such a rough time on the streets. There's some time that is spent just kind of healing and getting, having, what people describe it to me as they get their head together because it's a healing environment, and then they're ready to move to housing, and so having a specialist who can help them get connected to the housing and to get moved out and have that be in a seamless way. But it's very high, I just can't say enough, it's the most caring staff you would have anywhere, and just really upbeat, and it's not a coercive environment, it's a very, very positive environment. Does that help answer your question?
That does, and that sounds absolutely spot on. How do we identify those kinds of resources? Where do you look? And what track record do you look for to validate that people can deliver those kinds of services and that type of attitude?
So about 20 years ago, we in Columbus, we decided that we really needed a special place for people who are publicly inebriated to go and to be cared for, that was safe and made the connections. And we thought it was really important to have a competitive process to award the contract to the agencies that will receive that funding. But we had a community process which designed the request for proposals and developed the specifications collectively with all of the service providers, with the partners, with the neighbors to where the facility was going to be. And then there was a panel that reviewed those proposals and then selected them. But we were very clear in the specifications of what that organization had to deliver on. And I often recommended that process because it builds, you get to the best, and when agencies compete for that, they bring forth their best. But most importantly, you've been very, very clear on the specifications of what you expect to be delivered. And by including people outside of government in that process, because this was run by a government agency, but we had some outside reviewers, it just really made for a very transparent and community-driven process.
Thank you, that's great.
Thank you. Anyone else? Okay, great. So we will now open public comment. We have 40 people who have submitted cards. So this will go for a while. If you'd like to submit a card, please do so now so we have a count. If you're part of an organization and that person's speaking and you support what they said, they can ask you to stand. So you don't have to be repetitive, but of course everyone's welcome and encouraged to share what you want. So our first speaker will be Arlene Rosenthal.
I started wondering how long my bedtime, how many 40 people would take. But anyway, Mayor, council members, Thank you for this forum. Thank you for all you've done. And thank you, city staff. For those that might not know me, my name is Arlene Rosenthal, and I am president of the Well in the Desert. So, you know, I don't ever prepare, and I go with the flow of what I hear. Barbara Poppy was a delight to meet with. I thought I was going to hate her because you know how consultants are and stuff like that. And she's terrific. I may not agree with everything that was shown up on the screen. How much time do I get?
2 minutes.
Okay. Long story short, the well's been operating, as you all know, since 1996, and we've grown. We do so many things, too many to talk about. We're very happy with what we do. We need more space. We need larger services. I would like to start by saying that with this new happening, that we change the word NIMBY to YIMBY. Yes, in my backyard. And today alone, I took 4 phone calls from women who were about ready to lose their homes. 2 already were. What do I do? So I refer them to come into the well to get their services and be referred. And we try to get them into Martha's or the rescue mission, and we send them over to the boxing club for the evening. But we do get more and more. It's happening more and more with women and children, or women, men, and children, families, and seniors. And it is a crisis because more and more people are facing the streets. I heard one thing, and that is that there is land available at the boxing club. Why don't we work on this huge problem, take our time, make sure that we spend our money very wisely in something that's going to be sustained over years. But in the meantime, why don't we yesterday put up a tent like the ones that Martha lost? And Linda, did that tent hold about 100 people?
Arlene, you've gone over about a minute, so if you could finish. Okay. Yeah, and let's not have dialogue back and forth.
I'm suggesting that yesterday, meaning now, to stem these issues of people, women, children, seniors, sleeping on the streets or wherever they can find, that we maybe think about putting up the same kind of tent that Martha's lost because of lack of money. Okay. It's got AC, it's got all the facilities, and you can sleep 100 people. That would keep us going while the greater issues are solved.
Great.
That's all I'm saying.
Thank you. So that was the one card I had, so the city clerk will be calling out names, and I know you're getting some names from staff as well of people who...
But for right now, I will be calling names 3 at a time, so if you could begin lining up. Shelley Somerville, if you're capable. Shelley Somerville, James Gavin, and Maureen Ferreter.
Good evening.
Good evening.
Mr. Mayor, councilors, I'm honored to be here. You've heard me speak on this before. Those who don't know me, I am an ordained minister. I am a strategy consultant, and one of my high priorities in health and human services is the homeless. And by the way, before we start, who here has actually been homeless? I don't just mean in escrow between buildings, been homeless. I'm not seeing many hands up there. It is absolutely critical that you understand what's required. I was on the streets, my hand was up. I was on the streets in December, and I went to the well, and I now have a room. We need shelter. The boxing club is nowhere close. In my view, it's not managed very supportively. It's way too small. To the services, we already have a hub. It's called Well in the Desert. We need to expand it, and I'm very concerned that there will be some kind of bureaucracy and new development when, if we want to do this fast, what we do is we build on what we have. Maybe we can build on some, but tents we need to do something right away. Because I'm now volunteering on the front desk, I'm doing casework. It's not enough to have a paper pusher hand somebody a resource list. They can't get there. They don't have the transportation. They've got their homes on their backs. So I'm a caseworker. I take people to social services, Jewish family services, wherever they need to go. Because we need to do that. We need to help people. And it's hands-on, on the ground. So if you're going to staff anything, use the people that are already doing it and know how to do it. And please do the right thing and make compassion more important than politics. Thank you.
Thank you.
James Gavin, Maureen Ferreter, and then Mary Ann Estrella.
Okay, my name is James Gavin.
Wait, is the mic on? James, can you just talk right into it?
Okay, hello?
Yeah, as close as you can get would
Okay.
be great.
My name is James Gavin.
Thank you.
I know Miss Lisa and the mayor because we've had some issues with homelessness in our community. And I'm here to ask you to, if you haven't done it already, to take a tour of the Coachella Valley Rescue Mission along with Martha's Village. And because they have a lot of the bells and whistles in place that could put a dent in homelessness. Right now, the city of Palm Springs really is not putting a dent in homelessness. And we would encourage you to go to those facilities because they have drug rehab, they have shelters, they have stuff for families, they have medical. And it would be an easy thing to bring that facility out here and mimic what they have in the East Valley. And living where we live, it's been an issue with homeless, as the council know, and there doesn't seem to be any dent in it. And so I'm imploring you, if you haven't done already, to take a tour of those two facilities, talk with those directors, and see if you can mimic those things over here. Because they do have the bells and whistles in place to put a dent in it and to help the young and the seniors and everybody that's on homeless. Thank you.
Thank you.
Maureen Ferreter, Mary Ann Estrella, and then Robert Silker.
Hi, I'm Maureen Ferreter. Thank you very much for allowing me to speak. I just want to say what Arlene said. We need something immediate, something where they will be cool, of course, in this tent, and heated when it's winter. And the hospitals need to stop sending out people that have serious illnesses with a bag of lunch. And as I've witnessed today, I've been a volunteer for getting close to 20 years. I was at Roy's and also at the Well. And we just need something right now, and then the long term for the millions. Thank you.
Thank you.
And we do have youth, but they're living with their cousins and things like that. But because I was a tutor for the homeless, and there are plenty of youth in our Palm Springs area.
Thank you.
Mary Ann Estrella, then Robert Silker, and then Jace Grimm.
Yes, my name is Mary Ann Estrella. First of all, thank you for allowing me this opportunity. I am homeless. I am identified as a veteran. I'm a female veteran. I am also disabled and compensated. I have seen the horrible conditions at the boxing club in the last month that I have been homeless. I have witnessed the dignity of people taken away. I have seen people treated as an animal should not be treated. And if anybody is interested, I can give you the details. I was close to despair going into the boxing club and witnessing what I witnessed night after night after night. When I went to the well in the desert, I had hope. And because of that hope, my new goal in life is to become an advocate for the homeless, although I am still homeless. And we just can't continue in the conditions that we currently are in at the boxing club. I have been denied services there because I refuse to park a vehicle on their land because they do not allow sleeping in cars. It was parked in a public place, and I was told that I would be denied services unless I put my car on their parking lot, and kicked out the person who had nowhere else to go. That concludes my comments. Thank you.
Thank you. Appreciate you sharing with us.
Robert Silker, followed by Jace Grimm, and then Linda Barak.
Yes, my name is Robert Silker. Pardon my voice, I have pneumonia. I am currently homeless, and I have been for the last 2 years. I've been a resident of Palm Springs for 16 years. I have a degree in public administration from Washington, from the American University in Washington, D.C., the School of International Studies. The major problem with homelessness is finding viable jobs. My experience has been that the well in the desert is a true blessing, and they are compassionate and non-biased. And without them, I would not be alive today. I am without a bed tonight because the Coachella Valley Rescue Mission is an evangelistic, with an ambiguous definition of Christian organization. And I have witnessed their discrimination based on race, gender identity, and religious beliefs. And I am homeless because I stood up against that in a very civil and calm discussion. Now, I can be reached at Bert Silker, BERTSILKER, at Gmail, LinkedIn, and Facebook. This organization needs to be reviewed because the current manager of that operation, Mark McGowan, has quite a history of media coverage, and I believe that needs to be looked into, because someone in that position to turn away someone with pneumonia, because I am banned permanently from the boxing club. I have no bed tonight. This is not fair. Now, my protest was witnessed by the police, and since that, I have been harassed, and the people around me have been harassed, even involving the police on false calls through the boxing club and the CVRM staff that are operating it. That needs to change. If you're looking to partner with private agencies, you need to review them as you would your own contractors at your home or your healthcare provider, because that's what they're doing. I have seen the people from CVRM deny services on ridiculous counts because there are no written rules, and whatever they say is the rule. And sometimes the rule means a person with full-blown AIDS has out in the street on a rainy night, and that's based on a whim. That cannot operate. The indignity that I've gone through by when I was able to stay there, by sitting from 3 o'clock in the afternoon until 6 o'clock to cross the street and then be involved in a race, and literally a race with obstacles, approximately 25 yards to the wall. And where I land in line determines whether I have a bed at night. And the beds that are available to the general public after their discrimination is 3 to 4 beds. It's not the 50 beds that the building is rated for. It is insane the way that property is being managed.
Okay.
Thank you very much for the time.
No, thank you for sharing. Appreciate it.
Jace Grimm, followed by Linda Barak, followed by Darla Barkett.
Thank you. My name is Jace Grimm. I have a home in Palm Springs right now, but I struggle with the same problems that Barbara mentioned earlier, trigger homelessness. I own a restaurant consulting firm, so I'm going to talk about how our local food system can help solve homelessness with this money. I personally can help solve it by using my food-based business to provide good jobs and food benefits, as well as benefit all members of the community, and everyone should think about what they can do as individuals, not just with this money as bureaucrats. Someone mentioned the Housing First initiative, and let's remember that that program in Utah decreased chronic homelessness by 91% until it was defunded and failed, and we need to not repeat that mistake. This money needs to generate more money, so why not invest it in reliable jobs and businesses with the potential for profitability to bring more money into the local economy, create tax revenue to support future programs? Losing a job is the leading trigger for homelessness, and I've lost 2 restaurant jobs since I moved here a year ago, which is why I think we should break a portion of that grant that isn't going to housing to smaller grants and loans to support and encourage small sustainable business incubators and accelerators and lower the barriers to owning your own sustainable small business. My goal is to create a Coachella Valley food corridor with farms, stores, and restaurants where we provide great jobs, food, and business opportunities to the community while helping reverse climate change and invigorating the local economy, helping mitigate the seasonality that affects our local population and economy and lead to homelessness. The 8% for youth should go to education and basic education of skills like budgeting, tax preparation, and financial saving and investing techniques that will ensure their security in jobs and finances for them in the future. I didn't know how to balance my checkbook until recently or do my own taxes, and it has helped me keep the job and the home that I have. As a small business owner, I will lead by example and use my company to benefit my customers, employees, and the planet according to Benefit Corporation and Social Purpose Corporation ideals, and ask that everyone else does too, in partnership with our elected officials in control of the HHAP funds.
Thank you.
Linda Barak, followed by Darla, followed by Cheryl Shannon.
Good evening. I sound somewhat like Darth Vader. I'm getting over a cold that seems to be going throughout the valley. I'm going to do my best. My name is Linda Barak, and I am the president and CEO of Martha's Village and Kitchen. And thank you. As you know, we've started our recuperative care, and you guys need to replicate that down here. I was overwhelmed yesterday when I met with JFK and with Desert Regional as to the need. I cannot begin to tell you I've been on this quest for 10 years to make this happen. And it is so desperately needed, and we need even more beds. We're already going to expand at Martha's an additional 6 beds. But on what's going on in Palm Springs, when we opened the office at the Well in the Desert, in the first 8 months, we served 537 unduplicated people. These are your folks that are homeless. And it would break my heart that they had no place to go. We could work with them every day, but there was no place in the evening for them to be safe, for them to close their eyes, so that they could be refreshed to get up and go on that journey to end their homelessness. You can't imagine. When you look into their eyes, put your boots on the ground and look at the homeless and see what's truly going on with them. And there are families, let me tell you, a lot of them. Every night at Martha's, we have over 60 children, homeless children, upstairs in our units. Homelessness, I think I'm on my 3rd 10-year campaign to end homelessness. Have we heard about the 10-year campaign to end homelessness? Well, this is my 3rd. And I want to say that in Palm Springs, you guys have a remarkable opportunity and should be commended when everybody was poo-pooing that this was not going to happen, and look where you are today. I just wrote a grant and was told I pretty much wasn't going to get it. Well, we were awarded $500,000 for employment services that we will be bringing to Palm Springs, Desert Hot Springs, and Cathedral City. You don't stop now, you keep going, and you build more. And you look into the eyes of those homeless individuals and what they truly need. You need to be a visionary. You need to look into the future. Thank you.
Thank you, and thank you for your work.
Darla Barquette, Cheryl Shannon, followed by Brandon Church.
Good evening, council and city staff. I'm excited about being here tonight. Barbara, thank you for the presentation. I am Darla Burkett. I am the executive director of the Coachella Valley Rescue Mission. We are not an evangelistic service agency. We welcome all people. We hire all people. We love all people, and we've taken care of people for 49 years. But what I'm excited about today is I had 2 phone calls today. One with a lady that we put tires on her car to save her from becoming homeless. She's 67 years old. Either could pay her rent for February 1st or put tires on her car and make it to work. So I wish I had, in our agency, more diversion money. Last week, we had 3 calls for people that couldn't meet their rent. Their rent went up, their Social Security did not. So I love the multifaceted components of at least a 50-bed navigation center, along with the other components. I love the hotel conversion idea. I've studied it in San Francisco and some other places that have done it. It's for a certain level of person that can take care of themselves once you get them document ready. And a navigation center, one of the biggest components is getting them document ready. People off the streets come with typically nothing, and we get them document ready in about 10 to 30 days. Sometimes some documents take 30 days, birth certificate. But once they're at that point and we get them medically and physically health check and medications if needed, they're ready to go. It's the stock, it's the open doors. We're just so short on those open doors. So I really advocate for diversion money for all current agencies, and that 50-bed navigation center with the compassionate people, which is good. I think it would fill up on the first night. And I just congratulate you on going forward with this and getting the funding, and yay Palm Springs. I'm excited to be a part of it. Thank you.
Thank you, and thank you for your work as well.
Cheryl Shannon, Brandon Church, and then John Rickert.
Hello, I'm Cheryl Shannon. I'm formerly Dr. Shannon's daughter-in-law here, and I became homeless. I was recently evicted, and my father-in-law's dead now, but I've been through the cooling center, and I'm disabled. I take seizure medication quite a bit, and she's supplied me with a driver to take me to the doctors when I can't drive. And that is so much, and I don't know how they haul these people back and forth to the boxing club. It takes so much money. The food they give us is so nice, so great. I've gained weight. She's given me clothes. I have a stable phone now, and my doctors are on every appointment I've kept, and that's all I can say is that give her a bigger building to keep the people out the parking lots and out of the desert and stuff. But she does feed them no matter what they are or whatever. She feeds them, and I have a job available as soon as I can get. They said expedite the Section 8 for me, but it's 2 years. I don't know if I'll be able to make it in the homeless shelter or in the well for 2 years. But I do have a job available. I've already been approved by the SS. I'm on SSI by the DPS for a full-time caregiver. That is $14 an hour, as many hours as I need. And the well is also, when I call for help in the shower, they also send a female in there to help me with my trying to get dressed and stuff, or if I get dizzy in the shower or anything. They've helped so much. And that's all I gotta say. The Cooling Center in Arlene is the greatest. Thank you.
Great. Thank you so much for sharing your story.
Brandon Church, John Rickert, and then Tim Sigley.
Good evening, Mayor and Council and city staff. Ms. Poppy, my list that I had, you kind of took all my points. But I'm also homeless. I've been homeless for about 2 years. I was the former fleet coordinator for Vintage Landscape in Bermuda Dunes. Had a really good career, but I got laid off. Also, at one point in time, had a substance abuse problem. So I was going to RI in Rancho Mirage, which has helped me a lot. They referred me over to the well in the desert. It's been it's been such a blessing to have those people who actually care. And unlike the boxing club, where I'm currently banned from, because I have a disagreement with one of the people that work there from CBRM, because the supervisor let me go to retrieve my credit card from the store down the street, and then one of his subordinates said I couldn't come back, and I was 86 until he decided that I can come back. But you let people in there I've seen people in there with weapons, I've seen people in there with drugs. They found drugs 4 days ago in the bathroom, you know what I mean? The showers are dangerous. They have this thing up there that it's slick. There's no ADA compliance with anything that goes on. There's 3 porta potties, which are locked until 7 o'clock. So if you're sitting there from 3 until 7 o'clock to get in, you have to wait or go to the airport or go try to find, or I've seen people just go in the desert right there, in the middle of the desert, no cover or anything. It's just, something needs to change about it, because the people that are running that place act like it's their personal thing. It's run, I had, like, with the disagreement with the credit card thing last week, I ended up being arrested because I decided to peacefully protest how they're doing. I just sat there, and they called the cops and had me escorted, and I ended up going to Banning and being cited and released, which in turn, the police told me there are no charges, but they brought me down there so I could have a place to sleep because they knew I wasn't going to be able to sleep there. That's a problem, and it needs to be solved. Thank you.
Okay, thank you so much.
John Rickert, Tim Sigley, and then Tommy Clinton.
Yeah, thank you for having this meeting. This has been great. I'm just a recent resident, about 6 months, and I'm from Southern Oregon, and we're having the same sort of problems up there as you're having here. But the one thing that I haven't heard mentioned all evening, except for the couple people that stood up here and mentioned it, was you got to educate these people. You can't just feed them, put them in a house, clothe them, because they're going to be the same person when you do all that. They have no place to go. And the way we're solving it up there, at least we're trying to, is where, first of all, we're giving the people that don't have a high school education a GED. In fact, they've got to agree to do that training while they're at the center. And if they don't stay there. And once they get the GED, they got to make a pledge that they're going to go ahead to the trade school that we're starting. Because we've contacted all the people in the community that have small businesses. They can't find people to work in those businesses. People just don't want to work anymore. You need to train these people to work. You need to give them some education, and they'll work once you do that. So I think that's a component you need to add to this program, is education. I think you got pretty much the other stuff laid out really nicely, but I think you need to get an educational component in there. And that's basically all I wanted to say. Thank you.
Great, thank you.
Tim, followed by Tommy Clinton, followed by Ed Murphy.
Hi, my name is Tim Sigel. I'm a resident here in Palm Springs. And one of the things, I want to thank the council, previous council and now new council, for taking on homelessness. It's a big challenge. It's something great that you guys did to pull it together to get us this money, because otherwise, just as you see, many other cities are not doing anything for homelessness, and they're paying the consequences. So thank you for what you've done. One of the things I'd like to say that seems to be a little bit a part of what Barbara had to say, but there's some situations you can't throw these people all in one room and think it's going to work. You can't really put children with men. You can't put transgender people in there and think they're not going to be attacked. You have to make sure each one of their needs is being looked at and met. And it might take multiple facilities to make sure each one is getting the right needs met. And then, even then, we have to make sure we understand the point and count that happened today. There's a lot of people that are being housed temporarily right now that you're not going to find in the point and count. I know Tommy Clinton puts up people on a regular basis. I've put up people in the summertime on regular basis. I know Bruce Wise has put up people on a regular basis. And if any of you have not been to the Transgender Health and Wellness Center, I ask you to come and visit, come and learn what's going on there, and come and learn what the programs that they're trying to do to help many of them. And they're doing things for them that you're not going to see, because they don't like put these people out in front of everybody. They don't put them on Facebook and make them some kind of a mark in society. They just help them quietly and make them have a better life. And I think I would like Barbara to try to stop into the Transgender Health and Wellness Center and see all the programs. Now, they're located in Cathedral City, but they do not just service people from Cathedral City. They take care of everybody valley-wide. Thank you.
Thank you.
Tommy Clinton, followed by Ed Murphy, followed by Ragda Zachariah.
Well, you can't beat that opening. Wow. So my name is Tommy Clinton. I'm with the Transgender Health and Wellness Center. I got 2 minutes, so I'm going to speak very fast. So before we started, I presented this with you. These are letters actually support from the trans community. Also Casey from Path of Life, and also Darla from Coachella Valley Rescue Mission. Both do wonderful work. Me and Darla work on a regular basis for some of the trans people down there. She's warm, she's affirming with the trans community. The problem that we have, we're a very diverse community, and you cannot fit all people in one area. It deals with the problematic issue is culture. So when we face trans people, Darla and I constantly work on how some even try to contemplate how to get rid of them and move them out. So I really want you to think about this because and especially Lisa, being a trans person, I'd like to hear more words about how the trans people are going to be affected by this. And with this report, we noticed that our name wasn't even on there where we were even asked about homelessness of the trans community. About 29% of the people that we serve actually come from Cathedral City. There's an estimated 27,000 transgender people in the Inland Empire. 1 in 4 are forced into sex with someone that they know because for a place for housing. So these are really serious things we need to think about, and I think it's because we're new. We're kind of getting used to just having that expectation that we're left out of things, and I really feel sad about being in that position in Palm Springs. I'd like to see more activism with the LGBT community, and LGBT does not mean gay. It means all of those acronyms right there. So I think that one of the things we need for the trans community is we kind of want to do our own thing. Okay? Because if we put them in situations, okay, then you have to have experts to be in there, then you have to be able to deal with all these other issues. So it would be new, it would be something that we can do, but we're kind of forced in that situation because we have to look out for our own, and we're not really seeing in this report where we're being reflected. So, but I want to let the Palm Springs know that we're very supportive of you, and I know that all of you are very supportive of the LGBT community. I just think that we're just kind of forgotten about occasionally, and we'd like to be remembered and talked about. Thank you.
Great. Thank you. Thanks for your work, Tommy.
Ed Murphy, followed by Ragda Zachariah, followed by Dorothy King.
Hi, I'm Ed Murphy. Thank you for holding this. I'm a resident of Palm Springs. The last 30 years I have operated and worked in homeless shelters and homeless service providers in the city of Minneapolis. And I'm here to advocate for increasing the capacity of shelters, of shelter space for people who are on the streets. It's sad for me to hear what is going on at the boxing club. I was not familiar with that. I've heard of it. I was going to go visit it. Shelters don't have to operate that way. They don't have to be unsafe. They can be safe and dignified shelters, and that's what I think that we should be advocating for in this community. I have often heard, as I'm sure a lot of people have here, that shelters aren't the answer to homelessness, but they're not designed to be the answer. When I see somebody in a homeless shelter, I don't think this is an alternative for them being in their own housing. I think it's an alternative for them being on the streets. And I think it's important to have a shelter that's sort of a first step, last step. So when a person is sort of falling onto life on the streets, that they are caught. They have a safe place and supportive place to go. And when people are on the streets, they have a safe and supportive place to go to get back into the mainstream. Last thing I'll say is I have known thousands of homeless people in my life and worked with them. And I don't think I have met one yet who slept under a bush one night and got a job in an apartment the next. There needs to be stability and safety and security and support as a first step to be able to get into the other services that are needed. Thank you for the opportunity to speak here, and best of luck to you. I'm glad that you guys are holding this forum. It's very informative for people.
Great. Thank you.
Ragda Zakaria, good evening. I'm new to your town, and when I heard you're getting $10 million, I just couldn't resist coming to this meeting. I heard a lot of things. Barbara's presentation is great, but what I'd like to encourage you is not every business model is the right fit for what your needs in town. So I encourage you to look at what you really can do quickly, effectively, and for long term. You cannot start something by putting just a bandage on it. You need something, a place where everybody can feel comfortable and have hope, retrain, send them. You can separate them, you can design. And I know, and I'm glad to know that you cannot use this money to support other facilities, and you need to have a place to start. And I have the place for you. You know that area where the Cove developer failed. You have so many empty houses right there. It's already ready. All you have to do is just go and buy it. It's been empty. It's not going to cost you that much because nobody wants to live there. I've been trying to buy a piece of land there. I'm looking at it. But it's a great facility. It's close to Palm Springs, downtown Palm Springs. And this needs to be a grassroots, community-based project. You need to get the business people involved, the hotels involved. Every time you have a show or whatever going on in Palm Springs, part of the revenue needs to go to that new facility to support you in the long term. So here you go. You have the land, you have the building. You have to go and buy it and start.
Thank you.
Dorothy King, followed by Phaedra Nicomede, followed by Kelsey Brooks.
Hi.
Hi.
Can you hear me? Hi, my name is Dorothy King. I'm 72 years old, and I'm not homeless, but I have a complaint about that boxing club. I've never been in it. There's many people that live in the Point. We live in a government building, and we're having trouble with the homeless. Not all of them. Not all of them. There is a lot of good homeless. But the ones that is carrying the guns and the knives, I live near the back wall. They're pottying at the land in back of my wall. Now, my apartment's the back one, and I smell a lot of stuff. Now, during the summer, it's going to be really hot, and I'm going to smell all that. We have the homeless coming into our building at the Point. And I think the people that's running that boxing club should be looked into, because they don't keep control of a lot of the homeless. And like I said, I'm 72. There's a lot older people. And we're having homeless come into our yard. And we don't need anybody else to get hurt. And with the needles, the trash, you know, we keep our place clean. Why can't they pick up their trash? And then when I take my trash out to the dumpster, there's a guy in it, and I go, hey, we don't make much money. You know, there's no food for you from us, because we're just barely making it too. So I think I'd look into the people with working at the boxing club and respect some of them that can't get a bed. So
Great. Thank you.
that's all.
Phaedra Nicomede, followed by Kelsey Brooks, followed by Carol Rogers.
Hi, everybody. Last summer in July, I got to experience what a normal shelter was like in Bakersfield. I was abandoned there with just the clothes on my back and treated like a leper by anybody that I tried to ask for a phone. I just had nothing. I'd never felt more helpless in my life. You know, I was propositioned for sex by the people that were the clients there. The first caseworker who was pointed out to me as someone who would, you know, help get me straightened out, so I was pretty terrified from the experience. Pretty much like ditched out on me, like took a lunch break like really fast, and I went out the back door. And so I just want to follow up on what Tim and Tommy were saying about having a safe space for trans people, because there's a lot of things that are specific. And it's not us just being like, oh my God, we're trans, we're so special. You know, you have to be safe. You know, you have to be free from staff harassment. You have to be free from client harassment. You have to have people that are empathetic towards your problems and your plight, and not just sympathetic. The Trans Health and Wellness Center is by trans for trans, so we're trying to help each other, help ourselves succeed in life. And I hope that just bringing that up will help drive home to you guys that there are certain considerations to take into account that are just specific to us. And I myself, I'm 43, about to be 43. I'm homeless. I live in the open desert. I hope I don't look it, and if I don't, then that's a reflection on the help that I get from Tommy and the Trans Health Wellness Center. You know, the help that they give me, food, hygiene, and just my human dignity as well. Thank you very much.
Thank you.
Kelsey Brooks, followed by Carol Rogers, followed by Angelina Love.
Hello, my name is Kelsey Brooks, and I'm a volunteer at the Transgender Health and Wellness Center. I am a trans woman, and I feel the need for a safe space for transgender people. I take phone calls every week, and we have many people that are just destitute out of their lives. They're scared. They don't know who to turn to, and they call us, and we don't have the resources to be able to actually offer them much. We can provide them food, we can provide them mental health services, get them the medications they need, but when it comes to housing, it's not safe. The people out there are just trying to rent, they don't want to get them in there. The roommates that they are able to get to, the affordable housing, people do not want to be with us, do not be around us. So I urge you to take Tommy Clinton's advice and provide this safe space for us, because if it is not done, then we'll be on the streets, forced into prostitution, doing drugs, and not very well as we are now. Thank you.
Thank you.
Carol Rogers, Angelina Love, and then Wesley Ross.
Thank you. My name is Carol Rogers. I'm with the Desert Healthcare District Board of Directors. Thank you for City Council for your leadership and for sponsoring this report by Barbara. Very, very well done. Today I was part of a nursing team providing flu shots, blood pressure, and blood sugar testing at St. Paul's Episcopal Church in Palm Springs. More than 100 people, homeless people, showed up for a hot lunch served by the Well and the Desert volunteers. And thank you so much for the volunteers and the Well for what they do for our community. These people are in dire need today for housing and social services. My question is, what can we do today? They need a shelter. They need bathrooms, showers, and storage places, as Barbara stated. Food, they need today. We need 50 immediate beds as a start for a navigation center. I'm happy that we're looking into that as one of the solutions. But we also need to move forward for all the solutions that was presented tonight, including a proposal for tiny homes. Thank you.
Thank you.
Good evening, Lisa, Christy, Jeff, Dennis, and Grace. I stand before you today as a trans woman of color who stand at the forefront of the trans community and all the issues that we have wrapped up within our community. There is not a day that goes by where I don't get a phone call with someone asking me about what are they gonna do for rent because their car broke down, or what are they gonna do for rent, or what are they gonna do for dog food because their dog needs food, but they have to feed themselves first. I come to you today to ask that you guys think about programs, new programs that are trying to be implemented within the Coachella Valley, specifically for the needs of trans individuals. I actually brought one of my good friends with me who was actually relocated from Washington, D.C. to out here within the Coachella Valley so that she could be safe due to her circumstances within being in D.C. So with her being out here, she is now receiving services from us and directed by the district attorney's office so that she can continue to live authentically. Time and time again, I've heard certain organizations be praised, but in all, certain organizations have lack of competency when it comes to the trans community. And I ask that you guys take that into consideration when you guys are implementing these new programs and understanding that our community, we are not as finicky as you think we are, but we do have needs. And we just want to be safe within our own place, and we cannot stress that enough. So thank you for giving me the time to speak here today, and I hope that you take in consideration of the things that everyone has spoke to you about.
Great. Thank you.
Wesley Ross, followed by Christian Jelmberg, followed by Isabel.
Good evening. My name is Wesley Ross. I've been a resident of Palm Springs for 50 years. I am here to present 7 reasons for using a city-owned property for housing the homeless. Number one, it is unused and mostly vacant. It is located at North Civic Drive and East Alejo Drive. Number two, it is large enough to accommodate many housing structures or a large apartment structure. Number three, it is on paved streets with all utilities. Number four, it has a buffer zone surrounding the property from residential properties. It is buffered by city property, commercial property, and the airport, thus less likely to encounter complaints by local residents. Number five, it has proximity to a large medical facilities and immediate health care at Desert Oasis Healthcare. Number six, it is walking distance to Sunline bus service, bus line number 34, which goes north and south on Farrell Drive. And number seven, it has proximity to the main fire station, number 2, at the airport, and the police station at 200 South Civic Drive. Thank you very much.
Great, thank you.
Christian Jelmberg, followed by Isabel, followed by Robert Yates.
I'm Christian with Street Life Project Homeless Outreach. Some of you guys have been hearing about our Tiny Home Campus initiative. It's a valley-wide initiative to end homelessness. With the $10 million on the table, we have that capacity. And it's just not hearsay, it's not like a pipe dream, it's reality based on proven results of existing tiny home villages throughout Portland, throughout Seattle. We've done our research, we've done our due diligence, and researched every aspect of it. And the transition into permanent housing we've seen, based on the case studies, is between 40 and 80%. That's a high number, especially compared to a shelter model. If you're talking about a navigation center that can house 50, we can actually house the entire population for less than $6 million. So that's a big deal. That's a multi-site platform if we spread out the burden. I don't think the burden should just be on Palm Springs and for the entire west side of the valley. Let's work together with our cities, create a real tangible solution where they get all the services internally that they need. What they need and what's in line with the Housing First is stability, a roof over their head, overcoming all the objections of a typical shelter environment, where they have a sense of dignity and opportunity. We want to provide case management to connect them to all the supportive services, vocational training to get them educated in a skill set that they can turn into employment, and on-site micro-business opportunities, giving people an opportunity to start working again, start reacclimating into society. So you guys have a grave responsibility in what your decisions are going to be. We have a plan. We're looking forward to speaking with Barbara and going through it in detail. And I think it's about reinventing what's already been proven. We don't want to be like a tiny home village in Portland or Seattle. What we took is the best operating practices that are already established, and then we added to it. So we're looking forward to working with City Council. We have the builder that's ready. You're talking about quick deployment. They're ready to rock and roll and put these units out there. And one thing that's been said is that people are saying, we don't want temporary solutions. The tiny homes we're talking about building will outlast any of your homes that are existing today. So it's not a temporary one, but it's a flexible one in that it's quick deployable. And we can implement tiny home campuses within a month's time to accommodate up to 100 individuals. That's a big deal. And it can be as permanent as you want it. It gives you the flexibility of moving sites if you need to. So we're excited about working with you. We just want to be heard. We really want to make a difference. And guys, we can make the standard for other cities to follow. Let's do it right. Let's reinvent things and make it transparent financially in every aspect of the plan, and get other cities to do it too, and create harder restrictions on homeless dumping so we don't get other people dropping their homeless population on our city. So there's a lot of things we need to work on, but it starts with our tiny home campus plan.
Great, thank you.
Isabel, followed by Robert Yates, and then Pam Himner.
Hi, are you able to hear me? Okay, there we go. Thank you for letting me speak tonight. For what I have to mention about the house is, I have to mention about housing for the trans community. To be honest, I have not dealt with any transphobic remarks or anything of the like from the public, and I'm really thankful for that. But I want to keep it that way, not just for myself, but for my brothers and sisters of the trans community. By Ms. Clinton's need for funding for transgender help, for a transgender housing program, for those who need to be kept safe from whatever outside force has caused some place where the transgender community can call home while we get what we need to do done and completed, so we can begin living our lives to the fullest, starting with a safe home and shelter. The transgender health wellness center, which I take part in their mental health services, as well as I also do volunteer there when it is needed. They have done a lot for me. They show me that there are others like me in this very wonderful city. They have helped me grow as a person and has brought out parts of myself I never knew that had existed within me. This organization needs all the help it can get for what it needs to help us. So I ask you all, will you help us feel safe within this city? Thank you very much.
Great. Thank you so much.
Robert Yates, Pam Himmer, followed by Alicia Wood.
Good evening, Mayor and Council members. My name is Robert Yakas. I'm an adjunct professor of architecture at the College of the Desert. And I'm just here to tell you about a project that seems to have the planets aligning for us. It's the terminal project for the architectural design students at the College of the Desert before they go on to their 4-year degrees. And we've chosen this year to focus on transitional housing. And I've learned some new terminology along the way, thanks to Barbara. I think we're talking about rapid deployment bridge housing is what we're going to be looking at. And while it's a hypothetical project, I think it could produce something that might be a prototype. So I'm here to ask you to keep us on your radar. And it's a semester-long project. So at the end of the term in May, we may have some of you to come be the jurors on this and see what we've come up with. We're also going to put together a movie, try to make a documentary about this process, the design process as it relates to the homeless issue in the Valley. So my students are very excited about this, and tonight was a good education for me and for them, and I appreciate this forum. Thank you very much.
Thank you.
Pam Himmer, Alicia Wood, Dorothy Shoemaker.
Hi, I'm Pam Himmer, and I've been here in the Valley for about 35 years. I'm retired from the school district. This book right here, because I'm a thrift store junkie, caught my eye, okay? It's a great book. It's called Give Me Shelter, okay? The one thing that you need, first off, well, we need a place to put the whole plan. You've got to give us a place for the plan. Number two, you've got to have sanitation. You've got to have portable facilities for these people. You have to have portable showers. And I've seen these, you know, they're really beautiful, you know, men, women side. You go up there. You have to have some type of place where they can do their laundry. What I project is a tiered system. You have a tier where everybody can move forward. If you come into this place and you can act right, you can follow the rules.
Can you speak into the mic so people in the back can hear?
Do all the things that
Thank
you know you're supposed to do. You can earn credits. You can move up to the next level of housing. Instead of being here, like Arlene pointed out, you could have a big tent where people can intake. You can take care of them. You can decide, what do they need? Do they need to go here? Do they need medical? Do they need psychiatric? You can put a double wide trailer on that property and you can provide medical. If you want an AA or an NA meeting, hey, a 50-pot cup of coffee and a place to have a cigarette, and I guarantee you're going to have an AA meeting, okay? No problem, okay? Bring it on. Have them. As a part of the condition for you to move up into your little one-bedroom, you've got to play by the rules. You've got to help clean up. Perhaps you can learn how to run something. Perhaps you can be taught. When we get to the point that we could buy motels, we can get some of our local contractors involved, and you as a city can give them a discount on their permits for however long that they take. If you take an eight unit little hotel, you can make it into an 8 or 16 room facility for people who are in there and working. Get that contractor to come in here. Pro bono, he can teach. People want to learn. You don't necessarily need to give them something. Give them a hand on how to get up. Up in Sacramento, they had a 2-year program. I believe it was called Father Joe's Village. And you could only be there for 24 months. But during that time, you participated in the program and they ease you out. They move you into regular housing. So, real quick, sorry I went over. Worked 4 credits teaching self-governing down at Slab City. They self-govern. They know what they need. You know what you need out there. You know, everybody needs to act right. If you don't play right, you don't get to play in the game. Okay, move on. Okay.
Thank you.
Alicia Wood, Dorothy Shoemaker, and then Kim Bakar. Ms. Wood? How about Ms. Shoemaker? Bakar? Jim Bodanza. Followed by Julie Shullum, and then Edward Holthauser.
Good evening, Mayor. Thank you, City Council and staff, and all of you here tonight. When I heard Mayor Corr say that the best way to work on the homeless is to prevent homelessness in the beginning, that's what got me here tonight. Being a disabled senior myself, I'm finding some difficulties. I'm surprised because I've always been very capable, but with multiple disabilities and injuries over the past 20 plus years, I'm finding certain costs, for example, in trying to stay in your own home. Right now, there are proposed rate increases for the Desert Water Agency, for example, and as of July 1st of this year, they will be charging $33.53 just for the service charges. This is before you even use a drop of water. I'm finding this to be a difficulty because it prevents myself and some other seniors from getting prescriptions that they need and or even groceries because of the low fixed incomes that, like for myself, I'm forced to live upon because having been disabled for so many years, okay? So as a senior, I'm trying to stay in my own home, but I'm finding these problems because of this exorbitant charge. Also, there is a substantial charge on the tax bill for this, and plus there's sewer service charges. So that's a kind of an issue. I'm starting to see it, okay, the car breaks down, you can't afford the utilities, this water bill is really high. It's not even for the water usage, it's for the charge. So there's that. Number 2, I mentioned thought of some of these things, and I heard Barbara and others say the same things, and I think some of the things that could specifically advantage homeless are things like sponsors, life coaches, case managers, absolutely. And then there does need to be benchmarks and accountability for the people that are living in these environments, as well as work programs and training. I have an idea here in terms of adopt a family. A family could adopt, quote unquote, the homeless to bring them in. I've done it myself with mixed experiences, if you will. But I think that by involving people and have a place to go, someone who cares about you, check on you, how are you doing? What are your benchmarks? Are you meeting these criteria? I think those things could be very beneficial, give the homeless a sense of belonging. And also it could help seniors that need a little yard work, various other things. I've done all of that. One guy stayed 9 days. I thought that was pretty good. He was paranoid schizophrenic. I'm able to work with just about anybody, but I think that there obviously is no one size fits all here. But I think together, collectively, we can make a huge difference. Thank you.
Great, thank you.
Julie Shalom, Edward Holzhauer, and then Carol Nelson.
Good evening. My name is Edward Holzhauer, and first and foremost, I want to thank you for the efforts that you have done to get the grant that you got for housing. I was really moved by the supervisor. He said it's a matter of morality. We are all a part of the human race. So I'm applauding you on the efforts that you're going to do to help all of us, because we're all in this together. I'm also moved by the fact that the young man who spoke about the business that he's doing should be involved in the process. When we talk about wraparound services, it should not just be the things that are in place. We should encompass all of those, as well as reaching out to the community. As you've heard this evening, there are many ideas. Lastly, when I watched the whole presentation, the biggest thing that I got out of it was housing and then more housing. There needs to be some smart thinking on your part on how that's going to happen. I'm an advocate for tiny homes. When you can put a roof over someone's head and give them security, it's amazing. I have someone who worked for me who was homeless, living in her car with a 5-year-old, sleeping in the park. No one, and I mean no one, should ever have to feel unsafe. So you have your work ahead of you that's going to be long and arduous. But I think if you just take the words of the supervisor, is it morally correct? You will drive this issue in the right direction. Thank you.
Thank you.
Carol Nelson, Alicia Reyes, and Patrick Weiss.
I'll make this quick and to the point. You know, the tiny houses are a good idea, but it would involve too much. Well, I don't know. A good idea, something quick. I heard someone mention a motel or whatever. You know, buy a structure that is built already. There was a shopping center that I just heard they tore down in 2017. But anyway, I was thinking of that. It's already just restructure, because the and have you know, it would be immediate housing, and that would be the first step. But to restructure, there's some young people back here that are into architecture. I just heard. You know, give the structure is there already. If it's still there, it won't fall, you know, with the earthquakes and everything. Just restructure what is there. A shopping center or an old hotel is there with the plumbing. The plumbing and the kitchens, you know, all that is just too complicated. And cost effective, you know, it's right there. All you have to do is restructure it, and there's a lot of people, young students, that can think something new. And, well, you know, in the toilet facilities, and have a main kitchen to save money. But anyway, you know, everybody's... And what I have here is homelessness is a symptom of an illness. We in this country, we have to, you know, any symptoms of the real illness, we cover it up with some medication, you know, cover it up. I'm 81. I take no medication. It's lifestyle. I eat right. I get exercise. You know, and I've been a resident of Palm Springs for a long time. And I'm into recycling. I'm an environmentalist. Time's up.
Yeah, thank you. Thank you very much.
And yeah.
Elisa Reyes, Patrick Weiss, Gina Chapo, and then Ginny Fote.
Hi, my name is Elisa Reyes. I'm a mother of 4 kids, one that's going to be graduating this year, and I think about their future. You know, what if they didn't have the support system that they have, and what could become of them if that support system was taken away? I have one child who has autism, and he will need, help throughout his life, even though he's high functioning. I live in affordable housing, Coyote Run apartments. Those of you who are familiar, I've been there for 28 years, and it's been a great community. And what I propose is that you ask the Coachella Valley Housing Coalition to get on board with you and plan a rehab community for the homeless. I was watching the news and I saw the idea for the little homes and I thought, oh, well, they're cute. But I don't think it is the right plan for this project, maybe for, visitors, but it kind of made me mad. Is this the best that we could do? There's a lot of barriers that need to be overcome. And with the rehab community, you could implement, mental health resources there for them, community rooms for them to have their support groups, computers to have, access to technology so they could apply for their online jobs. Classes, I know in the community that we have classes there, language classes, we have computer classes, there's education, there's just, when I think of a rehab community, I'm thinking about not only just the housing, about all of the things that they have to overcome to become successful, and they need to become well, and we need to help them become well. And the Coachella Valley Housing Coalition has many different communities. They have communities for the people who are struggling with AIDS. They already have communities that are people struggling with mental health in Riverside and Indio. And they're already successful at what they do. So I ask you to say no to the little homes and think about a bigger picture, not what is simple and easy, but something that will be good long-term, that would help them be successful at what we're trying to do here.
Great. Thank you very much.
Patrick Weiss. Followed by Gina Chapo and then Ginny Fote.
Thank you for having this forum. I'm Patrick Weiss. I recently contacted the city about your rent control ordinance, and I read it, and I know the state has, Governor Newsom signed a bill where they have a new rent control ordinance where it's 5% plus inflation, which still can be quite high for people on a set income, like seniors and people working part-time, which there's a lot of that here. I have a roommate who's kept at part-time because Ralph's does not want to hire people at full-time because they don't want to give them the benefits, and that's very common these days. So I reviewed the rental ordinance. It's interesting. It looks like people, since 1994, they had a new ordinance going in 1994, but any new people moving in since then, since 1994, the rent control ordinance doesn't apply. There's also quite a few exemptions for landlords who can appeal some of the rent control ordinance by requesting a hearing at the rent control board. So it would be talking about affordable housing and people getting kicked out of their places because they can't afford the rent anymore. Maybe you should look at your rent control ordinance and see if that can be revised to make housing more affordable. The rent control ordinance was complicated for me to understand because there's quite a few provisions that have been added since 1979 when it was first implemented. So I don't know when your rent control board, I heard, only meets a few times a year, and that's usually if a landlord wants to contest something or have an exemption because they're not getting enough money or something from their apartment. So it's complicated for me to understand, but I would suggest that you look at your rent control ordinance as far as affordable housing goes in Palm Springs. Thank you.
Thank you.
Gina Chapo, Jenny Fote, and then Victor Beecham.
Good evening. Thank you for this forum. I really appreciated the presentation. I'm born and raised here in Indio, California. I grew up in Thermal. I was a model citizen, was able to go to UC Berkeley, and I studied the underdevelopment of the third world because that was the story of my life. And coming back here to the Coachella Valley, I worked with Greg for 2 years with Congressman Reese. I've volunteered, and now I'm a fierce advocate because I realize the Coachella Valley is underdeveloped by being based on a tourist economic model that in these last 40 years, because I just turned 40, I've seen how we've become impoverished. Focused like CVAG. I criticize CVAG and I criticize Riverside County because they focus on a tourist economy. Like in Indio, when I ran the office for about 2 years, Martha's Village, Indio effectively has become the catch-all for homelessness, and it's no coincidence it also became the biggest jailer of the desert. And what a coincidence that it's also the Coachella Fest, the city of festivals. So we need to be conscious of the role of government and what's the big picture. When casinos became legal, when Coachella Fest became something, everybody's looking into private-public partnerships, when you need to realize, because when I worked in Congress, foreign investors only come to pay for the land, and they don't really invest back into the community. So the fact that we're on a seasonal economy is forcing all of us to be impoverished. I grew up in land. I grew up with having everything, and now we are being displaced. So I think that we need to look at the bigger picture of what are the economic models that cities are going under, and also look at the cities. I've noticed that cities fight with each other for public monies, and cities, for example, the city of India, I've worked with them to work against the homelessness issue, and I realize that sometimes when I go to different forums, it's cities picking on other cities, or it's the Riverside County fighting with the congressman, fighting with the tribes. So honestly, we're all fighting, but we all live here, and we all have to realize we need to stop exploiting ourselves and start investing in our future and being more, giving to ourselves, investing in ourselves instead of selling ourselves out.
Thank you.
Jenny Fote, Victor Beecham, and then Maribel Nunez.
I won't speak that fast, but I just want to take a minute to thank all the agencies that are here tonight, and Greg and all the people who are doing the hard work, because it is hard work. And Darla, I know, has been doing this hard work for a long time, and I've worked with them, and Arlene at the well. And thank you to the city, because we took this project on homelessness, I don't know 8 or 10 years ago. And somebody came up earlier and said that we haven't made a dent. Well, before I left the council, we had rehoused 600 people, and that's now 4 or 5 years ago, so I'm sure that we've made a dent. It's just that people become homeless every day. And it's not just that you house everybody on one day and then there's no more homelessness. People become homeless every day. I thank you for the report. It was really very, very comprehensive. The one thing that I would add to that, and I think a couple of people have already spoken to it, is the fact that one size does not fit all. When I was the executive director of Mizell, we had a member who we hadn't seen for a couple of days, and come to find out she was 80 years old, and she had lost her house and was sleeping under the trash bins over at Ralph's. That's an 80-year-old woman. Well, how we would help her has got to be different of how we help that 27-year-old who is an addict, or the 15-year-old, or the 30-year-old that needs to just find a job and get some job training. So part of the importance for me of what we're going to do is to make sure that, as people have said before me, that we do create programs that look at the different needs of the transgender community, the senior community, the youth community, and make sure that those needs are all met, because they don't get all met under one roof. Thank you.
Thank you, Councilmember.
Victor Beecham, Maribel Nunez, and then Joan Davis.
Mayor, Pro Tem, council members, city staff, I first want to thank you for giving Path to Life Ministry an opportunity to come alongside of the great work that you guys have dedicated this time and era to complete. We want to really express how happy and how excited we are about what is taking place here in Coachella Valley. We've been in the trenches, we've been walking the streets, we've been in the fields, we've been helping the people, but we've also been working with the collaborating agencies and making a team effort to change the homeless population, to reduce those that are homeless in this city throughout the entire Coachella Valley. It's been a great opportunity for us to give a hand out and not, as some would say, a hand up. We do it different. We walk alongside the people. And what we've learned is that homelessness is not a person, it's a situation. And I'm so excited with the report we received from Mrs. Poppy, that all the things that she's talking about, I know that we're doing, that you guys have allowed us to be creative and help the people, and to know now that there are much more funds to support this work. It's really amazing. There's so much more opportunity to do the rapid response and the CSH housing and provide transportation for people to get back home wherever it may be in the nation, to provide that transportation for them, to have more resources for mental health, for addiction recovery, for those that have physical disabilities. People say that the homeless population is growing. It is. But I know by number that more homeless are being housed today than yesterday. I know 70-year-old, 80-year-old women that were gonna be homeless are no longer homeless. I know those that were 80 years old plus that were homeless have been housed. I know trans individuals that we've helped. I know children that we've helped get off the street. I know those that were in crisis, mental health and unemployed, were able to get stabilized. And I just thank Palm Springs again. I thank Coachella Valley. I thank the community. Because if it wasn't for the trust of the community and the willingness to do something different, we would be like many other cities where they're steady struggling, but you've been innovative, you've been creative, you've followed best practices, and you've made a difference. And I just thank you for an opportunity as a representative of Path to Life to be a part of that change. And I'm very excited for what's coming next.
Great.
Thank you.
And thank you for all your work.
Maribel Nunez, Joan Davis, and CJ Toby.
Hello, everyone. My name is Maribel Nunez. Thank you, Mayor, Council, and Barbara that's here. I don't know if you can hear me. I get nervous sometimes. My name is, again, Maribel Nunez. I'm an anti-poverty advocate. I belong with California Partnership and Inland Equity Community Land Trust. And we believe, we have a coalition, and we believe that health care, lack of health care, and housing are one of the biggest drivers of poverty. And so we're very glad to hear some of the preventative and intervention approaches to how we address homelessness. And so we are in support of some of the ideas that have been presented. I think that the thing that I do want to reiterate in regards to some of the intervention in what we're hearing in regards to housing, people that are homeless, there's no one shoe size fits all. And so I think when we talk about housing people that are homeless, I think we do believe in ADU or tiny homes, whatever you want to call it, because we do have families that suffer from domestic violence, and if they have a male child that's over 13 years old, they might not be with the mother at a woman's domestic violence shelter. So having that privacy, having a mixed use of tiny homes perhaps could be one of the ways that we could address homelessness. Low barrier is one of the biggest things too that we support. And then what we see also as prevention, just short solutions. Well, part of our coalition, we have local grassroots groups like Bayanihan of the Desert, TODEC, United Domestic Workers, Catholic Charities. We support the idea of now with the new state law with the ADU units that every city has to abide through the state to address issues of homelessness. We have partnered, for example, with Bayanihan to see if we could work with homeowners that would be willing to use their backyard to put a ADU unit, and we have a lot of support from the grassroots community. So we support projects like that. And like I said, we really ask that we support efforts of the community to be engaged, and we definitely feel that a regional approach is important. Thank you so much.
Great. Thank you very much.
Joan Davis, CJ Toby, and then George Wolf.
Good evening. My name is Joan Davis, and I want to say thank you to the council. I stand as an overcomer of homelessness. At 13 years old, my mom and my dad divorced, and we became homeless. So all homelessness is not because of drug addiction or misuse of allocated funds. It's not that. We need to address the issue. A lot of it is a learned behavior because of a situation. People that are hurting hurt others. We need to start first off with the idea of addressing the underlying problem, which is the hurt, mental illness. That is not a learned behavior. We need to address that fact that for a person to just be in the streets willingly, something is wrong. We need mental illness, they need treatment, skill centers. All of this needs to be addressed, and it can be done in a phase. Phase 1, phase 2, phase 3, and then you are transitioned back into a gainful society. I take people in off the streets. I'm a senior. Out of the compassion that all lives matter, you have babies, mothers with children walking the street, pushing their babies in strollers, people crying out to be fed. And one person, if each one of us would just have compassion and say, this could be me, and open your heart and not be judgmental and put them in a category, then we could move forward. I say thank you for all that you're doing and that you have done, but each one of us can do more. Open your heart and see that it's a soul and all lives matter. These children, they're our future. They're our future, and we have to do something. Something has to give. And I say thank you again.
Thank you so much.
CJ Toby, George Wolf, and then Denny Castillo.
Good evening. I'm CJ Toby. I'm the Director of Community Health at Desert AIDS Project. And on behalf of Desert AIDS Project and myself, thank you to the City of Palm Springs for your advocacy and hard work to obtain very important funding for our homeless neighbors, and also Barbara and your amazing team for your hard work and recommendations to this process. It was a pleasure speaking with you a couple weeks ago. Over the summer, the Community Health Department at Desert AIDS Project has collaborated with Well in the Desert, Coachella Valley Rescue Mission, Palm Springs Library, and multiple other organizations, churches, and entities to help provide services, more so to already support their wonderful efforts they've been doing for years. And By providing testing services, hygiene kits, food, Gatorades, insurance enrollment, and navigation to primary care, whether it was at Desert AIDS Project or just a primary care that's close to where our homeless neighbors camp because it's easier access for them, we've encountered issues to where there were providers that were not culturally competent to serve the complex needs of our homeless neighbors. We also obviously realized through the AIDS crisis in our 35 years of existence at Desert AIDS Project that someone can come in with one diagnosis, but if they don't have a roof over their head and food in their belly, it's really hard to address any addiction needs, any behavioral health they may need. And so the model that Desert AIDS Project currently has with their clients who are living with HIV, where we're housing over 60 clients where they can walk across the street and have comprehensive medical, integrated compassionate healthcare services, dental, behavioral health, career building program, social services, case management, linkage to care, an outpatient drug program, sexual health clinic. My recommendation would be that during the planning and implementation of these plans to address homelessness in the Coachella Valley, that housing is around a medical facility that offers comprehensive, compassionate, culturally competent care to our homeless neighbors to address their complex needs. Maybe it's a collaborative effort among medical facilities, but I would strongly encourage looking at that option. Thank you for your time and your hard work.
Thank you, and thank you for your work.
George Wolf, Danny Castillo, and then Christopher Rosner.
Hello, and it's a pleasure to address you. I come representing the homeless people who are sleeping in vehicles, cars, pickup trucks, vans, and our motorhomes. It would be nice if you could set aside $50,000 spread over a 5-year time period to help them with car repairs and maintenance. Some people will say that's not going to cure homelessness. It won't, but sleeping in a car is a lot better than sleeping on pieces of cardboard or in a tent. It's a good interim solution. Most of the people who are sleeping in cars are elderly people who worked for 30 or 40 years and their Social Security check is not enough to either pay rent or mortgage. Some people actually own their own home free and clear, but they can't cover property tax, homeowners insurance, maintenance, and repair. So they turn their house over to a realtor to rent out and then sleep in a car. This isn't going to change anytime soon. Is it possible to set aside 0.5% of the $10 million, which is $50,000, and spread it over a 5-year time period, $10,000 a year, to help these people? Thank you.
Thank you very much.
Danny Castillo, Christopher Rosner, and the last speaker I have is Ashley Boyd.
Mr. Mayor, members of the council, staff, thank you very much for your commitment to the homeless. It's certainly a complex issue, and you're not going to solve it with $10 million. It's going to go pretty fast. And I definitely agree that triage is very necessary, but I think there's some core needs that need to be met too. There's so many stakeholders involved that it's really, I did the count today, and I really don't think we got a representative count. And when I look at all the stakeholders, I wonder how data is being collected. And I really believe that some type of an integrated case management system where you can track data universally across all the different cities and stakeholders would really be helpful to assist these people in going from crisis to transitional to permanent housing. I also think the trauma is a really big issue. Everybody I talked to today told me that they suffered from PTSD. And so as we look at mental illness, I think we really have to look at trauma and the effect it's having on people. The other is parolees, people who are getting paroled. I didn't hear that come up, but a lot of those people get out of jail with a $75 check and nowhere to go. And so it seems like a way to put some prevention dollars in the prison system, so when those people are getting out, they have some resources. A lot of these people live with pets. And I heard that there's a lot of barriers to them. They don't want to give up their pets, but they can't go into any of these type of situations. So I would ask that you consider that because these pets are like these people's children. And the last thing is that there's a lot of dads out there with kids, but a lot of shelters will only take moms with kids. And I think that's changing now. And I would ask that if there are any barriers in any laws or regulations, that be considered so that that population can be served. Thank you.
Great. Thank you very much.
Christopher Rosner, Ashley Boyd.
Hello, I'm Ashley Boyd. I don't know, Christopher, I guess, lost a spot there. Okay. I'll try to make this quick and interesting for you guys, because I know you've been working all day already. But just some quick little facts and figures to throw at you. It costs about like $13,000 to $30,000 per year to house people, and it costs around $50,000 to $80,000 per year for us to have people homeless on the street, in policing, hospital bills, and street cleaning and all those things. So it is a significant difference, help to the taxpayers for us to house people. I know it sounds like that's probably not the thing to do, but when you hear those numbers, I definitely think that that's something that we should look at. Also, that 83% of people do get sober once they are housed. So that's something really important. People want to have people sober before they get into housing, but a lot of people are able to get sober once they're not on the street, having to be up all night just to watch their things or protect themselves. Girls get touched in their sleep every time they fall asleep, you know. So that is a really big thing to look at. Also, for navigation centers, I've actually gone to quite a few. I'm from the Bay Area, from San Francisco, so I'm familiar a lot with the navigation centers. They do a lot of things like the expungement, helping with expungement, helping with adult education, also with helping to get people into jobs. So I think that's really important for us to get, you know, some help as far as helping us clean our records. Once, you know, we want to get into jobs, we can't get into them because we have a record from being on the street. Also, it's just something to look at for shower buses. In San Francisco, Lava Mae does shower buses. So they converted old buses into shower facilities, and I think that's a really cool idea. A lot of times, people that are homeless, I'm homeless myself. I have a 2-week-old son, and I'm having a really hard time just getting help with getting us off the street. You know, I do want to work, and I do want to, sorry to take the time, but I do want to get into a better life and show my son a good example. And I'm really having a hard time with that, so it'd be really awesome to have some people to reach out and be able to help so that I can be a good example for him. Thank you guys so much.
No, thank you so much. Shouldn't be here.
Mr. Mayor, I do not have any other speakers.
Okay, seeing no other speakers, we will close public comment. Thank everyone who spoke and shared. I think council and probably people here probably need a 10-minute bio break, and then we will come back with questions and council discussion. So we'll take a 10-minute break. Thank you. And at this point, really the discussion is to give get some sense from the council on priorities for spending the money. There'll be a lot more later. This is not what organization or entity or anything along those lines. It's really going to be about what our priorities are for this first piece of the grant process. So I think it would be very helpful if Barbara Poppy would come back and really talk to us about eligible uses and your general thoughts, and from hearing everything you have tonight.
Yep, great, thank you. So I pulled back up the slide of the eligible uses, and this is in the order that the application puts them in. It's not in any priority order. But the first thing is you can do rental assistance and rapid rehousing. An advantage to doing rental assistance and rapid rehousing is, in fact, that is a one-time expense. You're helping somebody get into housing, you're paying their rent on generally a short-term basis, but you have to be able to access the private market. And you've got a challenge in this without enough units. But that is something that is a good use of funds. And in particular, I think we talked about particularly on people with fixed income where you're having rising rents, you could do a shallow subsidy, and that would be a great prevention strategy, I think, particularly for people on fixed incomes. Does that make sense?
Yes.
Okay. The next is you can provide operating subsidies in new and existing, all of these. And the challenge here is it'll be an ongoing cost to it. So you'd need to be prepared that when the funds are gone, you'd have to do that. So you might think about doing that because you want a portion of it that you, as the city of Palm Springs, could sustain into the future. But you're not going to spend all of your dollars here. It does say that you can include operating reserves, and essentially what that is it's a capital investment that stays with it that they draw down over time. But the operating reserves eat up a lot of capital because you're going to basically spend them over time, but it could make sense. The landlord incentives, those I think are really critical to do given how tight your market is, but they're also one-time expenses because you help one person, you don't create a forever, you have to do it, but it does, those flexible stuff will get people off the streets and out of shelters more quickly if they've got some extra dollars what they don't have to save up for. I think with outreach and coordination, in particular, you've got a really strong amount of outreach that's going on, and although you could fund more outreach, I think that is not the greatest gap that you have. I think on there is, from the focus group perspectives, there is this gap for clients and how they access the coordination piece to it is not as strong as it could be, but that's particularly as it relates to the public benefits. So you might get more out of having a stronger partnership and advocating with Riverside County to bring the services out here, make them be more same day rather than 30 to 45 days to make people eligible. And I don't think the HAP money will change that. That's more about an advocacy in that effort. That seemed to be a big gap. System support for regional partnerships and maintaining a homeless services and housing delivery system. So this is that you can use your dollars to kind of create a system. It's not the big, you're a small enough community, your system doesn't have to be that sophisticated. You need to have partners coming together and collaborating. Delivery of permanent housing and innovative housing solutions, I think this is where the biggest capital infusion will get you the most by doing that. And I think you've got, like I said in the presentation, you've got so many ways to get this done, as well as you've got some stock or land that you can do this. So it's like I can imagine you being able to do it because of the infusion of these dollars. Prevention and shelter diversion is really important. These are going to be one-time expenses as well because it'll be dollars that you used either to prevent that person's homelessness or to get to a quicker solution. And then finally, the new navigation center emergency shelters, and they've actually got a whole bunch of criteria based on demonstrated need. You'll meet all of those criteria. like I said earlier, we do want to get people inside. We do want to get people inside. I mean, it really is unsafe to be outside. If you spend all your dollars here, though, they'll come inside and they won't have anywhere to go. And you'll have people left outside in the end anyway. So it's really a balancing act here is to do some, and I think one of the things I heard from is there some ideas around how you do some lower cost options and partnering. So you can get to more emergency capacity through some of those easier partnerships, and those could be partnering with, say, a congregation that has a parking lot that they're willing to make available for people to park on, and they can make available that they can use the restrooms and the showers in the church, and provide volunteers who provide the night supervision. Now you're going to have some structure. It's called a safe parking program, but I can imagine you could have a partner with a faith congregation to do that because they're not using their parking lot every night, and it's a way that's a safe way to do it. But likewise, they could use their buildings. They could do, if you want to test and pilot a tiny homes model, that would be the way to test it, is in a place that's, because that, I will say, that's how most of the tiny home villages that I visited got started, is usually in that kind of a pilot partnership. So on the get people inside, I think I would use your dollars to do the capital and incentivize the services and the operations being paid for it. So if you wanted to support other jurisdictions who, close their cooling center, and then you saw people come to yours, it may be that you could make some small capital improvement grants that would help them get their facility in better shape. Because what I heard strongly from people is they want access to, restrooms and showers, and laundry. And you had very generous people who came here, but the reason why people urinate on the wall is they have nowhere to go. And so you can try to solve some of those, but through one-time capital grants. So those are the things I think that kind of fit in those categories. Does this make sense? Any questions on those?
Anyone have a question? Otherwise, I just want to ask, it strikes me from listening to everything I've read in conversations with you that, at least on the West Valley, we really lack the crisis stabilization units. And if we don't get people into a unit that's sort of their own, we're never going to be able to address the other issues. And so that strikes me as, given it's one-time money, to be the top priority, not that we don't want to do some other things with it. Obviously, if we can do things, and I heard this, in fact, today on the point-in-time count, you do have seniors who, the cost of living on their Social Security isn't coming close to the rent increases. And even the rent increases will be less under state law, finally. We're still going to have that gap. So, small amounts to keep them in their homes and apartments seems like a really other good use of funds.
Absolutely. On the crisis, if you did, I heard a lot of people in the conversation I had, were thinking is if you could do some motel conversions and have some units be crisis stabilization and some be permanent housing in it, that those small units are really sufficient. Came up in the focus group as well. So you could do a mix of both. What I like about the crisis stabilization units is it allows you to accommodate populations that struggle to be in a congregate shelter. And that was the dads with the children, trans, people with any kind of special needs. They get paranoid being in a congregate shelter. So it gives you some more flexible than a congregate only environment, and you've got stock that you could convert. And then you've got, the thing is once you can use it either way, because the unit is the same, whether they live there for the long term or it's a launching pad. So that's the other part that I think could be really appealing. I am seeing a lot more communities taking on that model of a motel conversion that gets people essentially into a single unit, but then use it in different ways.
Okay. Now, one other question, which I don't think we discussed, but because the amount of Section 8 vouchers that the federal government's providing is either probably less than it used to be, and rents have gone up what they are, there's that gap. And so when we as a council appropriated money so we could cover that gap, right, for folks, we were told we couldn't do that because it put them out of the income eligibility to keep their Section 8 vouchers, which is just bonkers, but the world we're living in. So are there other creative ways that you've seen people get around that issue? Because if we can cover $150, $200 a month to get someone to housing who has a voucher who's on the street, we want to do that.
The housing authority is willing to take their vouchers and project base it to a unit. And if you do that, then the rent is met, as well as that it speeds up the whole process. Because right now you have a long lag time between when someone is matched with a voucher and then when they finally find an apartment and a landlord. So essentially you take a voucher off the market for 5 or 6 months while they're looking for a unit. And then at the end of that period, they either can use or not use it. So a more efficient way to do it would be by partnering with them on the project basing. That's what they're interested in, because they're seeing too many units, too many vouchers go unused. And even when they provide the exception rent, it still isn't happening in your market. So actually, for this, I'm recommending a different approach, which is to partner with them to get to the actual units, because they need the actual doors, and then the rents are set at a level that works, and your deal should still work out. But you could do the shallow subsidy on top of someone who's just out of reach of it without the, when the rent is increasing, that shallow subsidy I think would make a bigger difference.
Okay.
Than trying to layer a subsidy on top of the voucher subsidy. You could also, sometimes you can do a capital down right, so that you provide capital subsidy and they agree to pull down the rent. It's a little more complicated, but there's a way to do it. You'd have to have a willing landlord, but it would get you doors, like this idea of getting you a door rather than just a rent subsidy.
Yeah. Okay, great, thank you. Anyone? Questions, comments, thoughts, direction?
Thank you. I have just a question. So I know we're looking at the eligible uses, and then today we're giving direction about which eligible uses we want to include in our application and what that might look like. You've recommended a lot of things, which, we have $10 million, which doesn't go very far. I assume one navigation center with 50 beds is going to cost more than $10 million. So or 1 or 2 hotel motel conversions, we pulled which hotel or motels are available in Palm Springs. So how do you advise that we sort of make those decisions about which few projects to fund or which are the highest priority?
So you will leverage the most other sources of funding if you do the permanent housing, because you can pull in so much more into those that those dollars will actually go further in terms of long-term, in terms of long-term uses of them, because there's a lot to leverage. I think on the navigation center or emergency shelter expansion, you'd want to stay focused just on the capital and, keeping it as lean as you can. It looks to be an area that you could also expect all of this, with these capital improvements. You could put out an RFP, have some matching requirements to it, and they can bring some private dollars to the capital as well. So that if you want, I would not, because as much as you want to use the capital dollars for the shelter, the navigation center, any of that, if you want to do an access center kind of, is you want that to draw other resources to it. So I would create that rather judiciously. I think you can spend dollars on rental assistance, whether it's prevention assistance or diversion assistance or any of, either one of those categories, and that becomes kind of your balancing point, and you can make the numbers out. So those would be I guess my categories would be the permanent housing and the innovative housing, and then the rental assistance and diversion. But it's in two different categories. They're both important, but they're similar, and what you can fund in those is you fund the cash assistance, not a lot of the services around it. And then I think then the capital improvements to create some more emergency shelter and navigation center capacity. That's the way I would start to, as I think about it, I think that would get you the most diversity, and it's going to be really efficient. I don't know if it's getting kind of late, so I'm losing my
Thank
coherence
you.
maybe.
Yeah. Dennis? Yeah. Great. There you go.
You know, I am in, $10 million, as you said, does not go real far. And so I am in support of setting up a system and any infrastructure that has a long longevity to it, where some of the, and I think you're in the kind of the same agreement with that, where, and then let the wraparound services, which exist very strongly already, be part of that formula. But I think, as my fellow council member said, a new navigation center alone might cost more than $10 million. And it seems like a navigation center would be a nice permanent start for something. But if the cost of that is $10 million, what would your suggestion be?
I wouldn't invest $10 million in a navigation center, even though you could. I mean, I've seen gorgeous facilities across the country, because if there isn't a way for people to exit that, it's never going to work. So every time I've looked at a number of these navigation centers. I've looked at tiny home villages. I've looked at emergency shelters, and consistently across all of those, when you have a high performer program, whether it's a tiny home village or a navigation center, the reason they're high performers in terms of getting people off of homelessness is because there's a housing placement that they can place them to. that creating a safe and secure environment is not sufficient alone. And so I think you would have a flawed approach if you only did a navigation center without doing the housing, either the housing through the rental assistance or the actual, I think you need doors and you've got capacity to do that. So I would focus on that. And the resources for the, because you shouldn't be funding the resources for services anyway. You don't want to build a fancy building that you can't support as well. So I try to be as modest as I could in that capital. I don't know if that's helpful.
And, I'm sorry, just to follow up on that, and in building doors, we're just really talking about transitional doors to get people from the street into stabilization, either mentally, emotionally, financially, to move on to permanent housing out of those doors, as you're calling them.
I'm recommending you do a good number of permanent doors, and you also do the crisis stabilization doors. I would do both, because you can really leverage. I think you'll get the greatest leverage if you're doing permanent supportive housing, because that's where the housing authority can come in with a voucher, and you can get some additional capital dollars through the county and through the state. You can leverage behavioral health services through a partnership with the county. And so you get to a complete, that's the place you can get to the complete sustainable package, whereas it's harder to get to all of those in a sustainable package just doing on the crisis end of it. So I think you do both.
Let me just on a follow-up on that. Currently, obviously, the boxing club, which will, starting in February, be able to be utilized by the day by people who are actually with case managers on services. It won't be just a place for people to be. And the Well in the Desert is an access point.
Yes.
Would it make more sense just to put a little capital into improving those facilities instead of starting over?
That's where I would certainly start.
Okay.
And what they need is they need better, they've got to have showers and laundry and storage, and storage and storage and storage. Places where people can lock their things up, have them be safe, they can go off to do their business and not have to trail all of their stuff there. I think that and those become the places under which they can do prevention assistance and diversion assistance. And there's already those things happening at the well. They just don't have enough resources to help as much as what the need is, but they also don't have storage for people's belongings. And anything you can do to get people to not have to have their belongings all out in the open, it's just better for everybody.
Great, thank you.
I have a comment, if I
Please.
can move to
Yeah,
council
no,
comments,
everyone
unless
can-
anyone else
whatever.
has questions.
Just keep it open. Go.
We'll keep it open. Thank you so much for your presentation. Thank you to everyone who spoke. Really appreciate people sharing their stories, especially people directly affected by homelessness. You said at the very beginning of your presentation, housing solves homelessness. I've been doing this work for about 10 years. I started doing it in the Bay Area, where I work doing Social Security disability as a legal aid attorney for people who are homeless, and I help people get on their benefits so then they could get housing. I tried to do that here for 4 years. I was a legal aid attorney doing Social Security disability here, and it didn't work because people don't have housing, and so then you can't get health care, then you can't get a job, everything else falls through the cracks. And so in my work here with CVAG, with the city, I hear again and again from providers, there's just not enough housing, that people are getting stuck in emergency shelter because there's nowhere to go, there's not enough transitional housing. And so I appreciate your recommendations, and I think they're great. So if my recommendation to the council would be to really focus on what you recommended, which is the delivery of permanent housing and innovative housing solutions, and then mostly that. If I had $10 million, I would spend a lot on housing so that there are doors for people, and then partnering with organizations and leveraging funding, because we just don't have enough permanent housing and we don't have enough bridge housing. And that's the situation that we're in. And so that's my recommendation. I would love to look at cost-effective models that can be deployed quickly, hearing from people that people are on the street sleeping right now and need services, and we can't continue to have projects that are $450,000 a unit or a door. It's just not going to work. So I would like to see us look at city land or other available vacant land that we can get for really cheap. I think the boxing club, the land next to that, or other city land is a good start, and see what kind of bridge housing we can put on those lots. So that's my comment. Thank you.
I as well want to thank Barbara and everyone who came and spoke this evening. There were many, many moving moments during the presentations that we received tonight, most particularly those from individuals who are now or have been homeless. And those stories are ones that we all need to remember. The safety net in this country is broken. And the evidence of that is before us everywhere we look in terms of the number of individuals that are living on the street. This is not something that we can take any kind of pride in. And it is up to those of us who are in public service to have solutions to these issues and to address them. And I don't think any of us can underestimate. We were thrilled when we heard that we were going to get $10 million. And then the realization set in very, very quickly as to how fast $10 million can disappear when you're trying to put together these programs. So I'm going to second the comments from my colleague, Mayor Pro Tem Holstage. I think we need to prioritize with the use of this money permanent supporting housing. I think we need to leverage that in making those investments with organizations and in places where they can also bring additional funds to the table so that our money becomes money that helps create other opportunities for investment. One of the things that, and I always compliment Jenny Fote for all of her work on this area, but she stole one of my lines tonight. One size is not going to fit all in this environment. We know so many different stories. If there are 200 people who are homeless today in Palm Springs, there are at least 200 individual stories that go behind that, if not more. Obviously, I was particularly touched in that many of those individuals share a journey that I have taken across the gender lines. And anyone who has been on that journey at any time knows how absolutely frightening it is, most particularly at the time that you take those first steps from one to the other. And we know within the community how many lose jobs, lose their financial footing, and find themselves on the streets. But that's just one of many stories that we have in our community, and our compassion and our heart has to be with absolutely everyone looking at 80-year-old women sleeping underneath trash cans to stay warm is heart-rending. And we have an opportunity to do something about that in this community. And we need to be about the business of doing that. Some of this comes to finding ways to speed up the process for approvals of these homes, and they are going to be homes, and making sure that we build them vastly more efficiently than we have in the past, and that we build them wherever we have city land or private land that we can work with. Every community in Palm Springs is a community in which affordable housing and permanent supportive housing can take place. Every community. Thank you.
Thank you. Any other comments? Councilmember Corner.
I do want to thank everyone for speaking. It's really important, and everyone spoke very bravely about their journeys and the things that they've experienced here. Barbara, I think you mentioned something about being able to have housing kind of intermixed with things and supporting purchases that way. That's something that I'm really interested in because I think that one of the things that we often see, especially when we're trying to expand shelter systems, is the stigma that's attached. So I do think that we need to be focused on housing, and one of the things that I'd like to see is if we can make sure that it's intermixed within our community. As Councilmember Middleton said, it is something that should be with everyone, and the last thing that I think anybody wants here is to have a motel maybe converted and then have that stigma attached to it. Not to say that we shouldn't also look at doing something like that with transitional housing, but I think part of the big thing is making sure that everyone understands that there are lots of reasons that someone can become homeless or lose their home, and none of those reasons should be considered less than anyone else. So I'd really like to see that. And I know that we have a lot of condominiums in the city, and I don't know if we have any idea of how many of those are vacant, but I think just if you look at the listings, there's probably quite a few that have been on the market for a long time that maybe deals can be worked out.
I just want to add that I want to thank everyone who did the homeless count today, including a lot of the city staff and the department heads, so big kudos to all of that. And I just wanted to say it was enlightening to see. I think that some of the stories we heard tonight are, with the right resources, easy to get people into housing, but I don't think that's true in every situation. And today during our homeless count, there were people that had been on the street for 10 and 15 years, quite some time. It was the way of life for them. It's the life that they knew. There was a 26-year-old kid in particular who had been on the street about 3 years and had no desire, clean-cut, good-looking, articulate young man who really had no desire to go into housing. He really found the free spirit part of his life. So I think there is a segment of our population that will always continue to be homeless, that will not be as easy to capture. But I do agree, if we storage, it was something I think is incredibly important. I think on two levels. One, you can have a safe place to put your personal belongings while you get yourself back on your feet, look for a job, look for housing. And I also think there's the perception of somebody hauling around all their storage in our downtown that's not good for our brand. So I do believe in storage as well. Thank you.
Thank you. So I agree with sort of the recommendations that we want the vast majority to be focused on both, permanent supportive housing and also bridge crisis stabilization housing. I think that's what we're missing. I do want to acknowledge our police chief and police officers and community service workers who work with our homeless population, who do such a good job and are so compassionate. And it's what we hear from homeless in our community here in Palm Springs is not what I always hear in other places. And the job you do is really extraordinary, so thank you. I think that those have to be the focus, because if we don't have a place for someone to be that's theirs, we don't address a lot of these issues, right? And Lisa, your comments come to heart, and it's true of other communities where being in that one-room dynamic doesn't work. But if people have their own unit, even if it's small, they have privacy and the dignity that's needed. And without that roof over their head, there's no treatment for drug or alcohol addiction. There's no mental health treatment. There's no ability, to get and sustain a job because you don't have an address. And we're lacking it very much. And so I think that has to be the majority. I think two other things we may want to look at, and I don't know if it's through this grant or if there's other sources, and we'll obviously work with the supervisor's office and the county on this. I do think we want to make sure we come up with a way to have some rental assistance to keep people who are on fixed incomes that are tied to the cost of living in their place that they live, when rents are still going to be going up 5% above cost of living in California. Because otherwise, we're going to be adding new people as we help others. And so the least expensive thing we can do is help someone avoid becoming homeless. So I just want us to be conscious of that, and maybe we include that in this request as just an option as we look at what other options we have. And the other thing, and whether it's from this grant or we really work with the county and CVAG, and you mentioned, Barbara, is, we had summer emergency shelters that the county, and Craig especially, figured out how to find funding to get open in Palm Springs, Desert Hot Springs, and Cathedral City, because we couldn't have people on the street when it was 120 degrees or living in their cars. And those closed on the end of September. We kept ours open, but we definitely saw people from the other two overnight shelters coming into Palm Springs. And not happily, because they'd rather be in their communities, in their hometowns. So figuring out, and it was one of CVAG's recommendations, at least figuring out how we can get those access points open in those other cities is really important. So people have some place to go where there is someone who can direct them to services. Because otherwise, they're either nowhere or they're coming here, and we don't have the capacity for everyone either. So I don't know if that's really tied to this application or it's through some other efforts, but I do think that's something, and you mentioned maybe small grants to get those going, that we should be thinking about, because we have to look at this regionally, even though the money came to us. We know we have to deal with this as a regional basis, and with our neighboring West Valley cities is really important. So if there's nothing else, I think we have enough direction from council on sort of the broad picture, that if it's good with the council, the subcommittee will continue working with staff and our partners to get that first piece in. We'll continue to work with Barbara, who's going to take a lot of the input tonight and help us on those next stages as well. So with that, just thank you again. Thank you for sticking with us tonight. I really appreciate it. If you're really looking forward to another council meeting, you can join us tomorrow at 6 o'clock at City Hall, which will be our next regular City Council meeting, and this meeting is adjourned. Thank you very much.